again for joining us for today's event, whether in person or on our live stream. And before we begin, I'd like to make a few housekeeping notes. So, as noted, this forum is being live streamed and will be available on the Institute's YouTube channel and the Institute's website. Secondly, considering everyone's experience, we ask that you silence all cell phones for the duration of the event. For your convenience, we have restrooms located on the first floor, and for those needing additional accommodation, we have restrooms on the third floor. Thank you. We'd also like to note our exits. In case of an emergency, please make a calmly exit. And if you need anything, please let Bridget Ebenhock, our conference manager in the back, or any of our staff know, and they'll be sure to assist you. Finally, we have designated time for a moderated discussion, so please refrain from asking questions until all presenters have spoken for their panel. Thank you. I'd now like to introduce Laura Rabinow, the Rockefeller Institute of Government's Research Director and Scholar of Science and Technology Studies.
Thank you so much. Thank you everyone for being here. Good morning. And I want to thank you to Nikaley. She is really a representation of the incredibly promising future of science and technology policy scholarship across our institutions when it comes to AI. I'd also like to thank our audience, our moderators, and our panelists today. I'm really happy to welcome you to the Rockefeller Institute of Government and today's AI Policy and Practice Forum. We are so excited to be co-hosting with the AI and Society Research Center at the University at Albany. And I need to give a particular thanks to Elizabeth Gray, Associate Director for Operations Strategy and Engagement at the center, and her colleague Bradley Hershenson, who have just been incredible collaborators throughout this process. As we noted on the invitation for this event, artificial intelligence is increasingly embedded in the systems that shape institutions, decision-making, and public life. Conversations about its technological development and governance are advancing rapidly across academia, government, and industry, but too often without meaningful synthesis across these areas. This event today brings together a diverse group of dedicated scholars, practitioners, and policymakers. And our panels cover a wide range of topics related to AI, from state and local governance to ethics and impacts to applications in healthcare and education. In short, today's symposium is really designed to strengthen connections between research, policy, and implementation, and to support a more coherent, effective, and ethical approach to how AI is developed, governed, and used. So we look forward today to a lot of engaging discussions and innovative ideas that can further support the thoughtful and responsive governance of these technologies. Thank you. Thank you all for joining us in this very critical conversation. And now I'd like to welcome our first moderator, Brian Nussbaum, Associate Professor in the Emergency Management and Homeland Security Department at the University at Albany. Dr. Nussbaum focuses on cybersecurity, terrorism, homeland security, intelligence analysis, and critical infrastructure protection, to name a few things. And he formerly served as Senior Intelligence Analyst with the New York State Office of Counterterrorism, part of the New York State Division of Homeland Security and Emergency Services. So please welcome Dr. Nussbaum, and I'd like to ask the first panel to please come up and take their seats. Thank you.
Thank you so much, Laura. I'm really excited to be here today. This event broadly, but this panel in particular, really represents a sort of Venn diagram of two really interesting and important areas. Obviously, there's the consistently high quality and thoughtful public policy analysis at the Rockefeller Institute. And then on the other sort of set that overlaps is the new AI and society initiatives at the University of Albany. And as many of us try to wrap our heads around what AI means for us, in my case for my students in my grading, but also more broadly for the future of all of these important public policy areas, I think this is the kind of analysis and discussion that we really need. So we have 3 presentations today, and as was mentioned before, please do hold your questions until we get to the Q&A session. We will leave plenty of time because I am not one to take the moderator's prerogative. I want the questions to come from the people who are here in the audience. Our first presenter will be Sky Suwanraksa, and from the Rockefeller Institute, where she serves as the Richard P. Nathan Public Policy Fellow. And her topic will be the Mirror of Accountability, a life cycle rubric for internal AI governance. How do U.S. state governments govern the use of artificial intelligence within their own operations? So Sky, please.
Thank you. So first of all, thank you so much for having me and for the opportunity to share what I have been working on. The topic that I have is Mirror of Accountability. All stem from the research that I'm currently working on. Thank you for helping me out along the way. So who am I? I am that human in the loop. I pride myself to be someone who is going to be in the middle of emerging technology and human. My career started at Apple for 7 years. I was the former genius, most pretentious job title ever. So you set the wrong expectation, right? You actually think about someone who's being called genius. What does she know? She has to know everything about everything. The first thing Apple tell you is, you don't have to know everything about everything. You just have to know where you can find the path to resolution. That's it. You just know your resource. And here we are all together. You guys are now my resource. Count on that. So I wear so many hats. There's so many different roles that I'm currently in at the moment. One as a fellow, one as an AI safety fellow at Georgia Tech as well. I'm pursuing my master's degree in cybersecurity. I'm also a part of New York State Forum AI steering committee. I am also an AI Members Impact Committee with PEF Union. I am a certified AI governance professional. I'm also a legal technologist. I am a public servant with New York State as well. So now we're talking about the mirror. When we are looking at all of the AI regulation and policy, a lot of time, most of the things mention something, the rule and regulation that we put on private sector. Public sector ourselves need to also stop and look at ourselves as well. And I'm sure all of the organization right now trying to implement AI in some shape or form. Yep. Everyone needs to learn, emerging technology. This is not new for us. We learn how to use the internet. We learn how to use computer at some point. It has the pros and cons. It has the things that we have to be aware of. So why is it so important for us to look at ourselves and make sure that we have AI governance in place? Because we don't want to be in the front page news and say something actually have gone down really badly. Now that being said, here is what the next thing that I want to present to you guys is the AI governance rubric. So what this does is it actually gives you the timeline of, doesn't matter what kind of AI deployment or application that you are thinking about using or deploying, it goes through the same process. You can always go back to it, and you want that consistency. So this is all the dimensions. We're looking at the governance authority. We're looking at pre-deployment controls. We're looking at post-deployment oversight, just transparency and access, and also the institutional capacity. And just so you guys know, this will be shared at the end. You will have an option to scan the 2D barcode, and you can, share this if you would like. Okay. All right. Next one up, we're talking a little bit more in details about the governance authority itself. The goal is to figure out who is in charge and what power do they have. So who owns that piece of deployment, that tool? Who's in charge? Is it a law? Is there suggestions? What happened? If your organization say, no, does it mean that you have the central authority to block the deployment or pull the plug completely? Who has that power? Next one up, pre-deployment. I think we spend a lot of time as an organization, spending a lot of time going through this process of figuring out what kind of risk assessment that would be. Is there any requirement? We have to look at, obviously, legal, liability, internal controls. But then, what happened after that? Next one is about post-deployment. And I can tell you that after an organization deploys something, who is actually in charge of auditing it afterwards? Who owns it? Who's keep testing it? Is there mechanics for the user to submit the feedback or bring up an issue and say, hey, this does not look right? Is there a process in place? Transparency and access. The goal is to assess how much an outsider can see. As a public sector, we're subject to the certain degree of transparency, despite knowing that, say, you get FOIL, and what kind of information you have to retain, what kind of information you have to produce. Those things needs to be considered. Last one is the institutional capacity. Do we have funding for it? Do we have the people that's skilled for it? Are we doing enough for our people to be able to use these tools safely, properly, and effectively? So the next step is, this is it. This is my goal. I want you to think of your organization. This doesn't matter if it is private sector, if it is public sector, nonprofit, all of that applies. Think about where you are in this process. Think about the gap of the things that you could implement within the next 6 months. How can we lift ourselves up? So, if you know where this quote come from, because we, the human, are here to just keep pushing through. Doesn't matter what kind of emerging technologies come out. And we can make change, and that's exactly why. Thank you.
Thank you very much, Skye. All right, our second presentation will be from Chris Stanley, the Director of Cyber Strategy and Risk and Director of Research Technology at the New York State Office of Mental Health, and the presentation will be expanding existing policy frameworks to support risk-managed use of AI. Chris.
Thank you very much, and thank you to the Institute for holding this forum and opportunity to be part of this panel. I am Chris Stanley, Director of Cyber Strategy and Risk, and the Director of Research Technologies for State Office of Mental Health. In those two roles, I sit in the intersection, sometimes it feels like in the middle of the intersection, of information policy, data governance, and emerging technologies. So of course, AI landed firmly in my lap. And has been an area we've been engaged in for quite a while. Today is designed to be practical. It's not a vision for what AI can be. AI exists. It's in our organizations, whether we know it or not, whether we want it to be or not. But I think we have some frameworks in place that allow us to leverage AI in appropriate ways and really take advantage of that. So next slide, please. So for starters, let me give you a little bit of context of what OMH is, because it serves as the foundation for my perspective for sure, and what I'll be presenting. So we are a large state agency. Obviously, we're about 15,000 folks in the workforce. We run 24 psychiatric hospitals, hundreds of outpatient programs. We perform higher education research through some of our affiliations, NYU and Columbia University Medical Center being two of the largest. In addition, we oversee licensed mental health services throughout the state, so all of the private, local government folks who are doing mental health services. So for us, these are some of the most sensitive health records available, right? Psychiatric information, histories, substance use. So these risks are real to us. It's not an abstract concept in our world. We're balancing all of this really in two separate fronts at the same time. So on the clinical side, we're trying to enable our clinicians to explore AI. How can they make better clinical decisions using the tools, and at the same time protecting the information that they have? In public sector, as I'm sure many of you know, staffing is hard, and certainly in public sector healthcare, that is certainly true. On the business and research side, though, we've got folks who want to go the other way, right? And we've been working with traditional machine learning for quite a while, for what used to be called big data, not all that long ago, when that was novel. But then also generative AI platforms. And through all of that, the work that we've always tried to do is to focus on privacy at the core, not trying to bolt it on afterwards, because honestly, that just never works. What we've found really is that our approach to AI and cybersecurity isn't all that novel with AI, right? The frameworks that we already have just need to be applied here. We need to call out the AI components and AI applicability within our existing policies and frameworks and whatnot, and make staff aware of how those things do apply so that they can work efficiently and effectively. So that's more or less what we've tried to do. Next slide, please. So obviously, generative AI is powerful. It brings or has the potential to bring real productivity gains. It is, of course, following a normal hype cycle, and there's tremendous enthusiasm for its use, great adoption, and then that trough of disillusionment as either it's hard to deploy, particularly, again, within government organizations, some of those challenges can exist, or we don't have the proper frameworks in place, and those risks overcome the enthusiasm as we experience some of those issues. Of course, the other challenge we have in state and local government is our compliance frameworks, our organizational frameworks don't move anywhere near as fast as the technologies, right? So again, these are things that we need to face as realities, and the more we can leverage existing tools, existing frameworks, the more success we can see here. Fundamentally, I think the tensions are represented with AI by the elements on this slide, right? We've got existing policy, acceptable use and internet policies, for example, data classification really becomes a key lever for us. I'll talk about that more in a little bit. But there are also those unique risks, right? The data sharing concerns, right? The data that's being input into these engines needs to be considered, right? And perhaps just as importantly, but sometimes less focused, is at the end of the day, these LLMs, they're opaque in exactly how they're processing, right? So we do need to make sure our staff are aware of considering the reliability of the outputs from their AI use. And all along and all through this, we need to be mindful that rogue AI use is going to maybe happen. It is certainly something we need to be conscious of, right? And how we can prevent it, and how we can also make sure folks know that those violations are problems, and they should be a little careful with that. So, next slide, please. Oh, I have the clicker. Great. There's really three main components here that I think we can all take away. First is that internet and acceptable use policies that you already have already do address issues of browsing and downloading software and accessing third-party platforms, right? So whatever you have there, it no doubt doesn't necessarily reference AI unless you've updated it in the last year or so, but it can, right? It just needs to be reframed or refreshed to call those components out. On the information classification side, this, from my perspective, really is the greatest lever, not only for managing AI use, but enabling AI use, right? So if information is classified as public, it's probably fine to use in an AI tool, right? And you need to let your staffs know that and know how to use that. That said, if it's PHI or PII or intellectual property or sensitive operational details, probably not. And for sure, you need to review the contract language and vendor agreements that you have to make sure that you understand how those things are working. On the third side, and not unrelated to that last comment, is your software procurement and risk management processes with your vendors. So reviewing those contracts, vendors, of course, are adding AI to their tools. So looking at, does your contract language support the levels of confidentiality, integrity, availability that you need with respect to that. And honestly, from state OMH's perspective, it's these contract pieces, the end user license agreements that are associated with all these sorts of things that have been the biggest barrier to using some of the AI tools. Some of the language in there is pretty broad and vendor friendly. And certainly our state council folk are a little squeamish about accepting many of the terms that are there. So to the degree that you can work with your vendors to modify that, you might see more success there. So next slide, please. So how do we pull this all together? In general, cyber hygiene is defined in layers, right? Cyber folks love their layers. So I'm no different here. At the high end are the technical controls. These are things like data loss prevention, egress monitoring, information rights management. These things might exist in your environment already. Maybe you're not using them because you didn't think the risks were sufficient enough. Maybe you are, in particular for your most sensitive data. But look into those, right? It may be a relatively simple matter of turning on some of those features to help you protect some of those AI controls or add some control there. At the middle tier are those administrative guardrails. So this is obviously where your policy items are, right? So reviewing and refreshing your policies, but also look at having a tool inventory, right? Approved tools that staff can use so that you know what tools people are using and can make sure that you have appropriate monitors there. Your network, on-network and off-network use might be a thing, right? If you can control your data, but you're concerned about the way, particularly an agentic AI solution may go after other things in your network, maybe you'll be okay with that tool in certain environments, but not in others, right? So again, looking at what sort of those network layer controls might be that you have in your environment as well. And then at the bottom level of all of this, and perhaps foundational, that therefore to all of this is individual training. We need to let our staff know what is and isn't okay, right? So this will range and be graduate levels of education along the way. Some of it's very basic. What is okay, just browsing the web, with a free AI tool that happens to be available, right? Versus more specific tools that might be used for more, in our case, for example, clinical use cases, right, with more sensitive data. You're going to want more training on that, right? More direction on how that works. In addition, as part of this, not only are you training on the cyber, hopefully, not only are you training on the cyber aspects, but you're training on effective use of these tools, right? So that, again, your staff can get maximum benefit, right? Things like prompt engineering are not cyber risk considerations necessarily, right? But again, as you're describing what a prompt is and what data you enter and those sorts of things, it's a very easy plug to describe how to use the tools efficiently and effectively, again, for overall benefit. So next slide. All right, so practically speaking, I think there's a few things that we all, if you're not already doing, can and should do in the next 30, 60, 90 days. So look at your data classification. If you don't have data classification, now would be a really great time to start that. But we probably all do have some level of data classification framework. Again, frame that with respect to AI and how AI tools might fit there from a data classification perspective. Update your policies, acceptable use, internet, information classification if needed. Even if it's just a paragraph, right, that references all the other stuff that they've learned and known for a long time. That's really effective. Identify, your organization really does need to have at least 2, maybe 3 tools available, potentially 4 different classifications in different environments, things like that with different use cases available, because folks do need, folks are going to use tools, right? So, we need to find tools that work for us, configured appropriate for us, so that they have a place to go. Even if it's not the tool that they want, it's one that, will basically meet their need. They'll whine and complain, but they'll at least have something and be able to work. So have that transparent so that folks know what is approved. In addition, anything else that they need to do, maybe something specialized, be prepared to accept those intakes and have transparency about those review processes with them so they don't tire and, again, go off on their own. In addition, particularly for the more sensitive workloads, look at using closed machine learning environments for your research data, your really sensitive information, whether that be contained within a vendor environment or a truly isolated no internet access sort of use case. Again, particularly for some of our machine learning environments, these are very powerful tools and can reach out to DeepSeek in China, and we'd be really sad if that happened, right? So guess what? Those systems can't get there, right? And those are just basics. So on the more advanced side, if you can click forward, there are those technical controls such as DLP, egress monitoring, information rights management, right? So there's technical things. I don't want folks to get bogged down, though, with the thought that they need to buy another thing or deploy some complex tool, right? These are things that, again, probably exist in your environment to the degree that you don't have them and can deploy them. Certainly look at that, right? But it shouldn't be an inhibitor, right, as you're maturing, to Skye's point earlier, through your AI implementations. Focusing on specific training, again, particularly as you're deploying more advanced tools, having more advanced training for those folks, and again, making really clear that rogue use of AI is not okay. So last one, I think. Yeah. So again, just some quick overview takeaways. Surface, pull out, highlight those AI-specific things that exist in your policy. Do your awareness campaigns, right, that you might be doing anyway around AI, and call that out. look at your information classification, make sure that that's strong and tight, and leverage that specifically. If nothing else, it gets people to think about information classification. If they get to use the cool tools with, low confidentiality data. Education really does need to come before access, but again, that's graduated, right? So focus on letting folks know what is generally okay, consistent with existing policy, things like that. As folks get more advanced access, more advanced training will come with that. And then you're applying guardrails really just where that education isn't reliable, right? Again, until you get to some of those real sensitive data cases. Rogue AI is a real consideration. Be prepared to deal with that, and then ultimately those advanced controls are there. The through line, though, and this leaning on our federal partners out of the NIST AI risk framework, attempting to eliminate risk, all negative risk is counterproductive, right? AI has value to our organizations, right? And we want to make sure that we are managing the risk and maximizing the benefit with those minimal risks. And we can do that, right? By naming the risks, by applying guardrails appropriately, and making sure our workforce is prepared. So thank you very much.
Thank you very much, Chris. Our third panelist is a longtime colleague of mine and friend, and works with an organization that I've worked extensively with and really love. Derek Werthmuller is the Director of Technology Innovation Services for the Center for Technology and Government at the University of Albany. And he's going to talk to us about From Pilots to Policy, Responsible AI for Public Transit and City Services in the Capital Region.
I'm Derek Werthmuller, Director of Technology Innovation at the Center for Technology and Government at the University of Albany. For those who don't know CTG, we're an applied research center, and in short, our goal is to help government make wise technology decisions. And so we do that through a combination of research and practice type of projects. Next, please. So I'm going to talk a little bit about AI success factors at a high level, and talk about some government problems that we've been working on, and how we're using AI in those, and maybe taking a look at some of the policy implications that are arising. Next, please. With the fever pitch of AI in the world now, all focused on models and technology and what company is doing what, it's always good to go back to the basics, and that's one thing that we at the center really focus on is the basics, and having a good problem to solve. What is the problem that you want to solve and that you think this technology needs to solve? Often. I'm a technologist, so I'm at fault most of the time, but I come to a situation with technologies in mind already, and then looking for a problem to solve. And really, we need to look at things the other way around. What problem do you want to solve? And is it a good problem? Is that a clear business need problem? Is it well described? Is there public value in the solving of that? So understanding the context, again, when we're developing things, we need to know who is going to be using this product, let's say, at the end. If you're improving a business process, then it's important to speak to everyone in that whole process, that from beginning to end. Next, please. So we've had a good partnership with the city of Schenectady for many years, and And so one of the projects we've been working on with them is really about information flow. As you can imagine, a city with about 10 square miles, there's a lot of territory to cover. On the left, we can see that, you know, their departments have routes. They're out in the field, but there's only a few people, and there's so much changing in that environment. As we can see, the middle picture, that's something that's changing in the environment. That happened overnight, and the routes didn't cover that location, and the other normal interactions for information flows didn't cover that. So that is one I'll get to a little more detail, but that's one problem that we're working on with the city of Schenectady. Next, please. Similarly, CDTA is the local busing transportation organization, and they have 380 shelters, and they're very interested in keeping those shelters clean, safe, and accessible. How do you do that? How do you keep that information? What is the current status of each shelter? That's a tough question. And then again, that's a similar information pulling in to a central place for people to make decisions. Next, please. So the way we conduct our work is we are process organization research experts, but when we engage with a government agency, they're the subject matter experts. They know the business better than anybody. They're in the business. So we use workshops and interviews to get to know and map out business processes. So in one project a number of years ago, we were interviewing city staff in regards to a code enforcement project, and we were talking to a garbage truck driver. And this garbage truck driver knew more about what was happening in this route than the other departments responsible for different, for codes and OGS. He knew more. He was a unique individual. He had an eye for these things. Can you imagine there's maybe 20 different drivers, so you could think about, well, how could we scale that so that he could share that information? Well, he was responsible for, his job of driving the vehicle, but also the safety of the guys working the vehicle. So really, it's not a scalable solution. So thinking like a computer person, I said, well, we could teach a computer to do this. There's a thing called computer vision, which is a division of AI. And so that's where we set off. We set off in creating a system where this sensor could ride along on the truck while they're doing their job and be a silent rider, but looking for those things that the other departments need information on to make decisions. And so, next slide, please. We've set up a pilot. We're piloting this with the city of Schenectady currently. You can see the left two pictures are us outfitting one of the garbage trucks with this sensor. And on the right is a CDTA bus. So the bus is testing this out also. Next, please. We call this Community Asset Tracker, or CAT for short. And on the right-hand side there's a list of classes or objects, things that when we spoke to the folks in the city and CDTA, they said, well, for bus shelters, we really care, let's try, there's a long list, but for the pilot sense, let's pick 5 things. Okay, so we're doing graffiti and broken glass, snow and ice blocking the entrance. Are the garbage containers full? So and then for the city, there's other things like blight indicators. They also care about trash and things like that. So we're in the process of piloting this, developing this list, understanding how this information can be used and how it can be integrated into their workflows. Next, please. To demystify some of the technology, right? This is what the sensor sees, okay? It sees this, and this model here is working for the city and looking for exterior property maintenance violations and identifies very tall grass. They have an ordinance. If it's more than a certain height, then people get a notice and that kind of thing. So that's the red box, and there's a green box that is covering or around the license plate. So that is dual purpose. So the first purpose here for the red box is notification information that's going to get passed on in a workflow. The green box in this case is the system on the vehicle is blurring that, so for privacy purposes. So we do the same thing for people. So if we see people, it happens, that blurs it, and then the rest of this information gets passed on to the city for their use. Next, please. Just another example of found trash, and we have the address, the location, the date and time, and all that kind of stuff that they need to make change. Next, please. So CDTA, here's some examples where on the left we have, the shelter's got snow in front of it and it's detecting that. And then there's garbage bin is full and there's actually trash outside of the bin on the ground. And that flows into a dashboard for them so that they can know the current status of a shelter at any one point in time. And then if they want to get more detail, they can see what specifically the sensor has found for them. So then they can, it's sort of like, I'd like to say the model is perfect. It's not. So this is a way for them to, okay, should we go there and send someone to, change the schedule? Okay. Next, please. So one of the things that, we're talking about how this might change how their team works. They, as for CDTA's example, they have a crew of 8 that are responsible for all these 300 shelters, and they have a schedule and how they, work them. But depending on how this gets deployed, this could be deployed at the managerial level only, and the manager uses this to do like daily assignments or use this to call a guy and, hey, this is really bad here, work this into your schedule. Or it could move down to the actual shelter staff level so that they could almost set their schedule and just be data-driven themselves. So some interesting discussions there and potential issues for them to work through. Of course, the normal things to deal with, privacy, confidentiality, data management. This is generates a lot of data. And so then, what do you do with this data over time? How do we manage this? What's necessary over the long haul? And also, what if this helps them achieve their goals? Their goals are to make sure that these shelters are clean as best they can in a timely manner. And with the current methods, it's problematic. But what if this system allows them to achieve these goals? Now, their focus, they can look at other ways that they can better serve their ridership. I think that's the last slide. Yeah, okay, thank you.
So, I believe there's someone with a microphone who will come around and as we take questions.
Hi, I'm Dr. Jasmine Cowan from Trevor University, and I have a question to Dr. Wertmüller. So I see that you, with these things that you can see tall grass, and you're sending out notices. But I don't know if anybody knows this. There's a YouTube channel, you know, the Blessing Boys that take care of elderly people. And I think, you know, I am worried that this becomes like a punitive, algorithmic-driven, you know, a space where you're going to be sending notices, perhaps to veterans or people who are unable to do it, and then basically force them out of housing without going and doing a wellness check and saying, this didn't used to look like this. Is there an underlying problem that we can solve for someone who is elderly or in need of help without putting $1,000, you know, fine as the very first response? Does this make any sense? I didn't do it.
Yeah.
It was the algorithm.
Yeah, completely, sure. The technology identifies the issue. It's really up to the authority on how they deal with it. They are dealing with these issues currently, you know, and there are plenty of room for community groups to be involved, and I think it's a great way to bring that information to the community groups. I've seen those videos. You know, how they can transform a property in no time and help people that are unable to do that themselves. And you know, I think it's for instance, Schenectady's been a great partner in this, like I've mentioned, and their goal is what they call compliance. So, and ways to help them get there. It's not, like you said, a punitive, we just want for fines. So I don't know if I've answered your question, but you know, we're continuing to develop this and working with the community. We've already met with the community once, and we're continuing to do so to get information, input like you suggest, and also ways that they can plug into this information also, so that so it's a positive benefit for everyone.
Can I piggyback on that, Derek, and ask a question? So in terms of a project like this, the resourcing and requirements behind it, can the community groups, can local private companies simulate this or do the same thing? And how obviously CDTA and the garbage trucks are doing these routes regularly, but there are other organizations that are driving routes regularly, whether it's Meals for Wheels or that sort of thing. How do you envision projects like this being scaled out outside of just the city?
I haven't thought that much about how other organizations could participate, because one of the challenges is coverage, and I think to highly trafficked areas are easier to cover, but generally a lot of time the highly trafficked areas are not the areas where people are in need. So how do you get to those areas where there are people that are in need, and so that need can be recognized? Yeah, I don't know.
Hi. Sorry about that. My name is Eric Stern. I'm the director of the AI and Society Research Center. I actually want to ask a question that I think is a little bit of a bridge between this panel and the next one. We've been talking a lot about responsible adoption of AI for good purposes by government, and I very much respect and appreciate the thoughtful, careful approach that's being discussed. But I'm also concerned very much about the irresponsible use of AI, and not even just by state employees using shadow technology, or you were calling rogue tech, but also bad guys and bad gals, not to be sexist, that are potentially weaponizing artificial intelligence. And I think this works at a variety of levels, even to lowering the transaction costs for spear phishing. And so you talk about the individual layer, but also Mythos, Anthropic's new tool, which seems to be able to do very sophisticated vulnerability diagnostics, which could be great for folks, for defenders, but also could point attackers in the direction of vulnerabilities much more efficiently. So I was just wondering if, particularly Chris, but the panel as a whole, and this is actually Brian Nussbaum's area of specialty too, if you have some thoughts about how the risk landscape is changing and what government might do to harness the power of AI for defense. Thank you.
Yeah, so I'll take a first crack. Others certainly welcome to chime in on that one. It's a great question, so thank you. And in practical terms, you're absolutely right. I mean, we're certainly seeing, the cliche, right, is that the phishing attacks are no longer, full of misspellings and whatnot. You almost, the better the email is, the more suspect it is now, right? Because we all make typos in our emails. AI doesn't. How about that? So maybe that is. But in all seriousness, we certainly are seeing an increase in successful phishing attacks within OMH for sure, and I'm told our sister agencies are also seeing the same. Right? Those are getting through the filters. So of course. In cybersecurity in general, it's always a whack-a-mole sort of game, right? So as the attackers get better, we try and ratchet up the controls within the solutions that prevent, and to some degree, that's there. With respect to code vulnerabilities and things like that, certainly our patch cycles, right? And again, this AI is certainly accelerating this, right? But it's been a trend we've been seeing anyway, right? You look at whatever research is out there, and I think the latest I saw was that from the time a rogue actor gains access to a component on your network, you have 29 minutes. Until they'll be able to spin that and gain more, right? And so again, AI is making these tools more effective, right? Which means our defenses need to be stronger. The monthly patch cycles that we've all experienced, probably not good enough, right? And certainly not waiting 3 weeks to make sure the patch is really stable before we deploy, right? Definitely problematic, right? We need to shorten those sorts of things and tighten the tools. In that way. To the degree we can leverage those tools, certainly we should have code scanning on our own apps and things like that, right? And to the degree that our tools can leverage AI. Obviously not Anthropic's latest model yet, unless your name is Apple or Microsoft, but the tools that do exist are good. And as I understand the Anthropic piece, it's really finding the interconnections, right? It has been the strength of that tool, right? So again, if we focus on our more unit-based vulnerabilities, we can gain some strength there. We in theory know our own landscapes, right? But again, looking at those dependencies, particularly from a code perspective, where we're leveraging, jQuery and all the other third-party things, right, that are automatically embedded in our own apps, right? But again, we need to stay up to date on those. So I don't know if others want to.
I would just add, I want to compliment Chris because in a lot of these discussions about the intersection between AI and cybersecurity, so much focus is on the sort of advanced persistent threat actors. And the fact that you brought up the rogue AI usage as much as you did, I think is really central, because I think organizations have not wrapped their head around this. In 2023, Salesforce surveyed 14,000 employees of companies around the world, and 30% of them, and this was in the quality of 2023 AI tools, 30% of them were using AI at work. Half of those were using it in what they considered probably outside of policy, and half of that half were using tools that were explicitly banned by policy. So any organization of any size is just going to have pretty extensive shadow AI concerns. So Chris, thank you for mentioning that.
Calling out the obvious.
Yeah.
Sure.
We'll go here, and then here, and then here. Actually, I think we probably have the same question. You guys can share. Craig Condra, I sit on the board of Sky's AI Foundation, and my question is for Derek. As capitalism outpaces policy, which seems to always happen, a tool that you're utilizing to be community-facing and to help the community, how do we walk that line of surveillance?
I don't know. So maybe in this case, you know, the advantage is, you know, we're a small organization. We're moving slowly. We're trying to move as quick as we can because, you know, someone else is going to catch up that doesn't have that don't have the same intentions that we do. You know, yeah, I don't know. Anybody else have any other ideas? Because yeah.
The thought that come to mind as you're presenting, and I don't know exactly how you're implementing, so sorry for putting you on the spot. But you know, certainly one of the protections, right, would be considering at what points that data exists, right? So obviously the camera is catching everything, right?
Yeah.
You mentioned that it blurs faces and licenses. At what stage in the pipeline, right, does that occur? What happens to that raw data, you know, if it exists at some period? And again, implementing policy, practice, you know, actual technical controls, right? That raw gets deleted the moment it gets filtered. And yes, you run a risk that like the filtering didn't work right and things like that, but you know, whatever. Again, not sure how it's working,
I mean,
but that would be an example
Yeah.
of how in these sorts of environments, you know, again, as we deal with clinical data, it's similar, right? We manage a de-identification before we do the
It's how that communication then goes to the public to let them know that this is not surveillance, this is meant to make your environment better.
My name is Matt, and I am the chair of the Artificial Intelligence Member Impact Committee for PEF's Division 357, covers all of ITS. Yeah, I had a lot of the same thoughts as Craig. Derek, I think your tool is great, but I think privatization is just full stop, never going to happen. It can't. Look what we're talking about with flock safety, with Axon. You know, in a public setting, great, but privatization, I think, cannot happen. And to her point earlier, I agree. I see this tool as negatively affecting low-income communities over other communities instantly. And I know from personal experience that Schenectady had, in the past, a problem with code enforcement affecting low-income communities, unfortunately because my father was one of those people who was doing it. And that's not great. And you know, I disagree with him on that. But my question is really for Chris, and I apologize. So Chris, on your slide about bringing it together, a risk management model, on your 3 tiers, how would you, I guess, break up a pie of 100% in terms of how much weight you should put on each tier? And I say that because I think that if you really nailed the individual training, I think the other 2 are a little bit less necessary, but I'm open to criticism on that idea and your thoughts on that.
Yeah, no, I think it's great, and it's a great question. I think the answer, as most questions are, is it depends. You know, it depends on your current maturity, where you are, what tools you have available, right? What's the low-hanging fruit maybe in your organization, right? I do agree with you that if you train the crud out of that, and all your employees, of course, are 100% trustworthy, then you're safe, right? The reality is some aren't, some won't pay attention to the training, those sorts of things, right? So it's the effectiveness of the training that's perhaps, you know, why having a single layer that there becomes, from my perspective, a little problematic. Having those policies, having the tools defined, that middle tier, right, again, sort of guides people so that if they missed a nuance in the training, they're less likely to get in trouble. And then again, you know, the technical guardrails, both for intentional as well as accidental, issues there.
So redundancy.
Exactly.
I feel like
The layered defense.
cybersecurity people are always
We're always layered.
Oh,
I
no,
know.
but also always skeptical of training. So I've seen phishing training exercises where they're not trying to be persuasive. They say, "Do not click on this link," and they still get like a 2 or 3% click through. And so if you rely entirely on training, it has the potential to be.
In fairness, we have research to back that.
Yeah.
Negative perception of training.
So,
Yeah, Lauren.
sorry to interject.
Yeah.
Laura Rabinow, Rockefeller. My question is for Sky. You, I know, have developed this lovely kind of like way of thinking through state governance. I'm wondering, as you look across states and their relative implementation of the kinds of best practices that you're looking at, how many of them are doing the kind of things that like Chris is doing so well over at OMH? Can you create tiers or buckets? How do you see that happening across different states?
So I am in the process of gathering all of those information right now, looking through state by state, and then ranking them with all of the rubric that you guys saw earlier. One of the things that it's reflects right away, even just the initial part of doing this part of research, is that state government that stand out are the one who already have something published, already have some transparency, already know that they need to work with all stakeholders to be able to implement something and do it effectively. Key one, you guys can look it up at, for California. California has its own dedicated page and information. Doesn't matter who you are. If you are an agency trying to implement something, here is how you do it. Here is the journey. If you are public and you want to know more about how, state government is using AI, what kind of AI tools you have. There's your path right over there. Those paths are very clear for some state. And so in the case of New York State, near and dear to my heart, we have, you can see the acceptable use policy. You can see, you will have, the information is available to you to see what kind of tools that is already available. Does it left a little bit more to be desired? Absolutely, because wouldn't you want to know if you are a New York State, citizen? Wouldn't you want to know what kind of tools are being used at where and how? And how does that impact you or your loved ones? So the clear, the clear findings eventually will come, to play, and I know that will still taking some time to gather those information. But at the start of this process, that is one thing that had been very clear, is the folks that already know that public needs this information, and they know that they would rather get ahead of it and provide those things. So, thank you.
I have a follow-on question, actually, that cuts across all three of the presentations. I've always found, so not on the state government side, but on the local government side, I've always found local government to be sort of an odd descriptor. So you have a framework that's designed to work with lots of different types of organizations. OMH works with service providers who are often local governments. Obviously, cities are local governments. But is the category local government useful if it includes New York City and Guilderland? Or if it includes, Westchester County and Hamilton County? Is it really useful for us to think of local government as sort of a group of entities? Or should we just be tiering by size? I guess I'm sort of curious about the resource questions that arise when a county that has more cows than people is just a different entity than Nassau County, right? And so could each of you just speak to the question of, is local government a useful frame? And if so, how should we think about the resourcing questions? Reliance on vendors, right? There are just some places that are going to be able to do really good evaluation of their vendors because they have very high-end, serious, professionalized IT systems. And then there are the ones where it's like, well, we have the town's website on my cousin's web server. And
I'll start. So one thing that popped in my mind is that, say if you have multiple smaller cities that, would want to come together, form some kind of coalition, wanting to learn something or, pursuing some kind of training together. It'll allow them to have the power to, say, negotiate, to maybe, collaborate with bigger institution. That would be something I can see it happening with the help of, say, New York State or the help of the bigger organization. That would be something I can see it implemented, yeah.
Yeah, I would agree with that. I think there's third-party not-for-profits and whatnot as well that serve in that space. If we think, Center for Internet Security and ISAC and things like that, right? So there's things that those smaller government entities can really just copy-paste, find and replace, hopefully, and meet a bunch of their needs that way. But the point is well-founded, and again, it's a matter of leveraging the tools that you've got, and the needs are going to be slightly different there as well, the expectations.
In our experience, sizes of populations are a better way to categorize their capability. This is not based in science, but a metric that I use is if the local government serves a population of around 100,000, they're probably understaffed. They don't have enough staff. So as you get larger, then they have more resources, and then they can behave. Then they can have more of those things. It's not on their friend's web server and things like that. So.
Hi, I'm Leandra. I'm with the Department of State's Division of Consumer Protection, and we focus on fraud, identity theft, and scam prevention, things like that. And I just wanted to open up a question for any of the panelists feel comfortable answering, thinking about accountability in the sense of deployer versus developer, because sometimes they're not the same entity, and thinking about, who is responsible in case of things we have like data breaches, disparate impacts. There's a lot of different players and, different outcomes can come with this. So broad question, but for anybody who feels you have something to answer, I'd love to hear more about that.
I'll start with, going back to my first dimension, which is the authority. Having that defining, role, I think this is drawing back to, say, incident report. If that happened, if some incident happened, who own which parts? So that has to be identified right off the bat. Who is the owner of this application, and who is the first contact, the second contact. All of that has to be, thought about even before anything could be deployed. I'll let you guys.
I agree. One of the considerations, again, that I mentioned in my presentation, but I think speaks to that is you really do need to review those agreements, right? So particularly in a vendor sort of relationship, right? The contract language is going to have indemnification clauses, right? Which define who's responsible for what there. And again, you need to look hard at that and understand that. The other factor with that, in particular in government, is to some degree it doesn't matter. If OMH is using a tool that had some flaw that caused data to leak, they're not going to look at that vendor as the problem. That was OMH leaked the data, right? So at the end of the day, we have to recognize we will be publicly seen as responsible whether we had direct control or not, right? So again, that's why we need to make sure that those protections are in place.
Hi, how's it going? I'm Cassandra Klowicki. I'm a project manager at the New York State Thruway Authority. And I guess my question was more focused on the first two presenters. So AI use is kind of already widespread at the authority. It's a little late for the pre-deployment controls, or like education before access is kind of late for all that stuff. So what would your advice be to an agency that's just kind of starting to create an AI policy? Like, we have a data classification project that's kicking off hopefully soon, and I feel like a baby in this room. So anything you could say to help us out?
I would start with nail down exactly what is your critical information and critical business function, right? So like in the case of OMH, you have PII, you have this very critical information that cannot be exposed. So once you know what is it for your organization, that way, yes, you can still work backwards to like, hey, is all of this still okay, even though we're already using this, tool? Working that way, once you understand your core business function, you know what's important to you, prioritize that before you go through and then prioritize anything else. Again, you can, work with all of the stakeholders, help identify all of those, laid it out, and go from the top and keep going.
Yep. Yeah, I mean, I would agree, right? You have to take bites at the problem, right? How do you eat an elephant? One bite at a time, right? To the gentleman's question earlier, training is probably a great place to start, right? Because if your employees are aware of the risks, then even though they've got access maybe to more than you want, and you're trusting the employees maybe more than you want, at least if they're aware, the responsible ones won't get you in trouble. It'll just be the ones who don't care, which it is then where your additional policies and controls, as you mature those out over hopefully a rapid, again in government terms, time, can help you out.
Have you had to change a lot of people's status into management confidential as you start classifying data? You know what I mean? Like, deciding that this is confidential, does that mean that now whoever's accessing it is management confidential?
We certainly haven't, because all of our employees deal with confidential information, right? So PEF will be happy to hear that we are not planning to eliminate all of our union representation.
So I want to thank our panelists. It's 10:45. We are going to break, and we will come back to the next panel at 11 o'clock. Thank you so much.
I want to say thank you again to our first panel and to Dr. Nussbaum. And now I want to introduce our moderator for our second panel. We're lucky at Rockefeller to work with Sadia Rahman in her role as a New York State Science Policy Fellow. Dr. Rahman has her PhD in computer science from University at Albany, where her research focused on developing predictive models to inform high-stakes decision-making, particularly in the areas of homelessness and financial inclusion. As a science policy fellow, Dr. Rahman is currently working at the New York State Assembly Ways and Means Committee. Please help me in welcoming her.
Hello, good morning. Thank you so much for that introduction. Thank you all for joining us today. I'll be moderating this fantastic session. It's AI risk and ethical challenges. So in this session, we're really fortunate to have 4 distinguished panelists. So we have Matilda Scott, who's a policy analyst with the Rockefeller Institute of Government. We have Professor Archana Krishna, who is an associate professor in Department of Communication at the University of Albany. We have Juba Santi, a policy advisor at Empire State Development, and we have finally Professor Mila Gasco-Hernandez, research director of the Center for Technology in Government and associate professor in the Department of Public Administration and Policy at the University of Albany. So as we all know, AI has been continuing to grow so much and so rapidly. So a number of important concerns that are coming up quite often, including expansive growth of data centers, or privacy issues with the data being used with AI systems, or biases in the decision-making processes, and questions associated with those, questions of accountability associated with those decisions. So today, each of our panelists will speak on these topics, and we'll do a brief presentation at first, and we'll leave the final 15 to 20 minutes for audience Q&A. I'm very much looking forward to this conversation. So starting with the concerns with data centers, there has been numerous proposals for data center developments, and it has been quite rapidly rising as well. So there are really two sides to this story. So on one side, many argue that we need these increased capacity of data centers to support the AI race that we are in right now. And on the other hand, there are a lot of pushbacks coming to these data centers from local community. They're mostly worried about environmental concerns or the growing resource demands of these data centers. And to speak on this and give us a better understanding of this, I would like to welcome Matilda Scott. Her topic is Clouds, Cable, and Megawatts. State and localities grapple with the data center boom.
Yes, thank you so much for that introduction. My name is Matilda Scott, and I am a policy analyst here at Rockefeller Institute of Government. I'm also a PhD candidate in environmental sociology at the University of Utah. So oftentimes my expertise is really kind of in environmental justice issues, but I'm really happy to kind of explore that lens through data centers and how local and state governments are responding to these concerns. Okay, so let's hope this works. Perfect. Okay, so I think as everyone in this room knows, AI has led to, or this boom in AI usage has led to a really increased demand in data centers, along with other technology like cryptocurrency and an increase in cloud storage. So as these demands have exploded, data centers, which are really the backbone of the internet and this infrastructure, they're in great demand. And this boom has created a significant conflict for both state and local governments. And policymakers are caught in this difficult trade-off, the promise of economic growth and an expanded tax base versus the reality of massive energy demands, water usage, and rising costs for residential utility ratepayers. So today we're kind of looking at how these tensions are playing out across federal, state, and local levels. And a much more in-depth report is going to be published in the next couple of weeks from Rockefeller, kind of outlining this. So this is just really a brief summation of these findings. So it seems that a lot of people in this room may have a technical background, but just a little bit of table setting. What is a data center? So when we kind of look at the history of computing and computers, earlier we had much bigger computer rooms that date back to the 1940s. And these modern facilities now are much smaller, right? So as computing chips and technology has developed, we now have massive server rooms. And I think sometimes for people with not so much of a technical background, it's confusing when we use a data center, but you're really interfacing with a data center anytime you do anything on the internet, right? There's a physical infrastructure, even though we only really see this digital side. So in data centers, we have server racks, which hold computer chips, CPUs and GPUs, GPUs are used for the complex math required by generative AI and other technology. And then we also have additional infrastructure to help support the data center. So because this equipment generates intense heat, constant cooling is necessary. And this is where a lot of concerns about energy usage come in. So traditional systems use air conditioning, but newer AI-focused data centers oftentimes use more efficient liquid cooling. But this still is a really resource-intensive technology. So then we also have different categories of data centers, smaller data centers, a lot of the conversation right now has been with hyperscale centers or really large data centers that are oftentimes used in AI. Besides the cooling infrastructure and the servers, there are also backup power facilities, uninterruptible power supplies, and then also generators, because these facilities have to be running constantly. So within the landscape of data centers, the United States really is the undisputed global leader. So depending on which source you're using for counts of data centers, we have at least about 5,400, and that is much more than our closest competitors like Germany or China. And then within the United States, domestically, Northern Virginia is really the epicenter of data centers. They process an estimated 70% of global traffic is going through Northern Virginia. And then as of February 2026, Virginia has 570 data centers, followed by Texas with 407 and California with 288. And we're also seeing emerging tech corridors in places like Columbus, Ohio, and various markets across Illinois and Georgia. So the economic pitch for data centers is really focused on jobs and taxes, but the reality of the impact of these data centers is much more nuanced. So while a typical build of a data center may employ, 1,500 people during construction, permanent operational roles are much smaller. So research shows this kind of employment cliff, where for every one permanent job, there was 12 to 30 temporary construction roles, depending on the source. So we're really seeing, job creation, but much more in this temporary sense. Additionally, a lot of proponents speak about potential tax revenue generation. So we see, for example, $733 million in taxes were paid in 2023 in just Loudoun County, Virginia, which is one of those Northern Virginia communities. But at the same time, data centers oftentimes are the recipient of massive tax subsidies. So we know that at least 36 states offer data center specific tax incentives. And there's also an issue where only 11 of those states actually have to disclose which companies receive them. So there's a bit of an information discrepancy there. So the environmental footprint of data centers is also something that advocates and communities are very concerned of. So the environmental footprint of data centers is really staggering. A single hyperscale facility can consume 876 million kilowatt hours per year, which is the equivalent of about 81,000 US homes. So one of these facilities can really use as much energy as a whole community. And water is an equally concerning issue. Some of these facilities can use 5 million gallons of fresh water daily for cooling. So especially in places that are water scarce, places in the desert, oftentimes in New York, we don't really think about water because we're blessed to have so much of it, but in other communities, this is a real concern. Air pollution is an additional concern. Researchers estimate that backup generators from data centers in Virginia could already be contributing to 14,000 asthma cases and other health outcomes. And this same study found that US data centers in 2030 could contribute to nearly 1,300 premature deaths annually, just due to air emissions. And researchers have noted that these impacts are not equally dispersed. Counties with the highest percentage of public health costs, which is what this study was quantifying with those air pollution numbers, oftentimes have a median household income below the national median, meaning that low-income households bear a disproportionate burden of these public health risks, so they're not equally spread out. So families are also concerned about rising costs associated with data centers. So in states with high concentration of data centers, we've seen electricity rates rise by 12 to 15%. In Northern Virginia, energy demands are projected to drive up residential bills by $33 a month by 2040 just because of data centers. And beyond these costs, there's also issues of noise pollution, where residents who live near the facilities, specifically in Northern Virginia, have reported a constant buzzing or humming noise that can reach levels harmful to hearing, and obviously affecting property values as well. So here we see basically the policy brief that we are publishing kind of outlines this transition in federal policy. So we see earlier iterations that were focused before this generative AI boom, really focused on internal efficiency. And then with the rise of this AI boom, we're more focused on global AI competition. So the 2023 Data Center Enhancement Act focused on cybersecurity and resilience. And then last year, in 2025, the One Big Beautiful Bill Act was signed to help bolster AI. And then we also see a slate of kind of executive orders that were issued to ease federal regulation burdens and expedite permitting for data centers. And notably, the administration has threatened to withhold funding, including $42 billion of broadband funding from states that enforce onerous AI regulations. So the federal administration has been really kind of fighting with states that are proactively creating their own restrictions on data centers. So again, at the federal level, we also see some legislatures or some legislative actions that are working to protect consumers within this. So we see a few different proposals, including the Protecting Families from AI Data Center Energy Costs Act, the Power for the People Act, and a lot of these are aimed at preventing data centers from shifting grid update costs onto residential ratepayers. And then we also see initiatives like the Clean Cloud Act, which would mandate annual emissions reportings and a net zero requirement by 2035. And then most drastically, last month, we saw a proposal called the AI Data Center Moratorium Act, which would halt all construction until federal safeguards are enacted. And as we're gonna go into later, we just had our first state pass a moratorium last week, Maine. So we see these kind of popping up at both federal, state, and local levels. So states have really taken a lead compared to the federal government. So we know that at least 22 states introduced legislation in 2025. And we see a move towards these kind of categories popping up. Again, we see legislation about ratepayer protections, renewable energy requirements, siting restrictions of where data centers can be built, tax incentives, grid reliability initiatives, and then ultimately we see moratoriums. We just saw the Maine one finally pass, and that's the first in the nation. Virginia has emerged as a legislative leader. Recently, they passed, I think, 15 bills that end these kind of range in data center requirements, including mandating noise sound profiles, requiring water authorities to report drinking water diversions, and creating a voluntary load shedding program to help protect the grid during peak usage and to kind of increase grid reliability. So we also see these initiatives kind of pop up at a local level. So we are seeing some localities in response to states being so slow and the federal government being so slow to use their zoning and land use authority to fight back against data centers. And this includes creating bans and moratoriums, zoning updates, and local city council rejections. So Groton, Connecticut, and Peculiar, Missouri are two localities that have effectively banned large facilities after public pushback. We also see this in Arizona. Tucson City officials denied an annexation request to block a developer's access to municipal water supplies. So we see these kind of creative approaches that are really tailored to the local community's needs and pushback. So one organization that's been tracking this is Data Center Watch, which is part of 10A Labs, an AI security company, and they've been tracking a huge increase, 125% increase in grassroots opposition during the second quarter of 2025. So this has meant that they've blocked or delayed $98 billion in projects because of local opposition and advocacy. So this image on this slide shows a public meeting in Wilsonville, Alabama, and it shows the intensity of like local sentiment. So advocates oftentimes have been quoted saying that they feel that big tech is preying on small rural communities, and they're successfully organizing to demand transparency and push back on this kind of corporate overreach that they see. So in New York, we currently have 134 data centers according to according to datacentermaps.org. And we have some contentious proposed projects here, like the stamp site in Genesee County, that have faced legal defeats and legal wins due to some environmental concerns and lack of consultation with the Tonawanda Seneca Nation. So we see these contentious things playing out in New York State as well. There's also a proposed data center in the town of Lansing in Tompkins County. This is not surprising for the New York State Governor, Kathy Hochul. She even brought this up in her State of the State this year, but her actions have not really translated into budget actions for this year. But we do have proposed legislation that New York State lawmakers have been working on advancing. So these include the Stop Subsidizing Data Centers Acts, which is in regards to a sales and tax use exemption that data centers currently have. And then we also even have a proposed moratorium right now. So it'll be interesting to see how this plays out across this legislative session and future legislative sessions. But in our report, we're really excited to kind of detail this a little bit more and explain this all. Data centers is such a huge topic. I hope you can appreciate that this is just a very brief slice of it in this presentation.
Thank you so much for that insightful presentation. I'm really looking forward to that report. So staying with the broader questions of AI risks, let's take a look at data privacy. So again, AI systems require massive data for being trained, and that brings up another really important tension. So we have, on one hand, privacy principles which only require you to collect data that are only necessary, but on the other hand, we do need large, diverse data set to train these models so they can understand they can capture the nuances and the complexities of human knowledge. So to speak about this, I would like to welcome Professor Archana. Her topic is the AI Catch-22, negotiating tensions between individual privacy and comprehensive data, training data for Gen AI models.
Thank you. Thank you for the opportunity to speak today. I'm Archana Krishnan. I'm a communication researcher, and I have been studying technology for the last 20 years, ever since grad school. And I must confess that even with an undergraduate degree in computer science, all of the lingo is fairly new. And so I've been doing a lot of homework, trying to understand the jargon, because I want to try and understand the terminology as I research even the socio-economic aspects of this technology. So before I start, I'd like to quickly acknowledge 3 sources of intellectual support. One, my home department, the Department of Communication at Albany, the Center for Technology in Government. I've been a faculty fellow there since 2023, and that was when I started really thinking about the policy implications of my own technology-based research. And finally, the AI and Society Research Center. I'm a research fellow there this year, and they have funded my first major AI project. And even though today's talk is not directly related to that project, it did give the impetus for me to start thinking about risk, mitigation of risk, and privacy. You must have all seen this particular diagram, or the Venn diagram. For undergraduate students, it's a really easy way to understand and contextualize these terms: machine learning, deep learning, artificial intelligence. It's sometimes easier to explain the impacts on society, economics, financial systems, health inequities, if you can explain to the students the definitions of what they're trying to first understand or study. Even though AI seems to be the new buzzword, it has been in the scholarly domain ever since Alan Turing established the theoretical foundations in 1950. So we must definitely give credit to this pioneer. Even generative AI, Gen AI, though seemingly in the public consciousness for the last few years, ever since the launch of ChatGPT in 2022, the field itself has been as an established field since the 1960s. Why it's important to understand this is that this is not really new technology. It's been an slowly evolving technology, and it has had its few winters in the 70s and 80s, but right now, because of a lot of data processing abilities, hardware changes, is why we're starting to see this boom. So in the evolution of AI and across its variations, whether these are deep learning algorithms that propel self-driving cars quite literally, or are sophisticated conversational agents like ChatGPT, what has remained constant is the use of data sets to train AI models. The seemingly sudden scale-up of AI has been chalked down to sophisticated hardware, obviously, like graphic processing units, but also massive training data sets. In fact, contemporary models like GPT 5.4, they seem to be updating every 2 months, it seems like, and Claude Opus 4.7 rely on data sets that are actually a combination of different kinds of data. So first and foremost, they source data from publicly available sources, websites, coding platforms, Q&A forums, chat platforms, books, news articles, blogs, and so on. One issue that's outside the scope of this talk is obviously copyright infringement, but the other is low quality, misrepresented, and/or biased data. The issue is not just the quality of data, but it's about whose data is actually publicly available. Not everybody who is online is visible online. My group's own research on online lurking suggests that personality traits like introversion and neuroticism and communicative traits like online communication apprehension are significantly associated with preference to consume online content without actually contributing to the online content. And it also it's associated with one's choice to limit their online visibility. So the question then remains, whose data are we actually training these models on? Then there is synthetic data generation, where data are produced and designed to mimic real-world data. They're generated either using statistical methods or by using deep learning algorithms. In many cases, synthetic data is necessary because it serves to bridge a gap. It's important when data is neither unavailable or it's difficult to achieve because of compliance issues. However, generating synthetic data that can reflect the statistical properties of real-world data may also inherit biases, such that minority groups are often underrepresented in synthetic data. Then there's reinforcement learning from human feedback. So in this, human reviewers rank different responses to prompts, and the rankings enable the AI model to then learn which responses are more appropriate. This obviously enables for data efficiency, but it is subjective, fallible, and risks personal biases and judgments. Furthermore, biases can be introduced at multiple points in the output generation process. Consider this hypothetical example that I revised from a 2021 review in algorithmic bias. In a loan approval process, a risk analysis algorithm may be trained using a data set that reflects disproportionately higher rejection rates for female applicants without really relevant reasons, such as perhaps differences in credit scores when compared to male applicants. The algorithm will then look at the data and then assume that gender is a relevant factor in assessing credit risks, and consequently will replicate and reinforce this gender bias that might have previously led to biased loan decisions. If then human feedback is incorporated, individual biases and prejudices against women might be reinforced, thus producing output that's seemingly objective on the surface are actually the sum total of biases incorporated at separate levels. The example that I just described is unfortunately no longer hypothetical. Apple was accused of gender discrimination a few years ago when it was noted that the algorithm used by the Apple credit card for credit limit decisions seemed to be giving lower credit limits to women compared to their own spouses, despite the fact that couples had shared assets, bank accounts, and in some cases the female partner had a higher credit score. Regardless of ethical and methodological concerns, we all note the fast adoption of AI by individual users and organizations alike. In fact, the demands for training data have never been higher, as Gen AI increasingly are being incorporated and integrated into existing platforms. Limited sizes of data sets, for example, in medical imaging, often result in poor generalizability, with models trained at single institutions or with single models frequently underperforming. So this low external validity is especially problematic when considering healthcare decision-making. There are also perceptual and behavioral consequences attributed to AI bias. According to a systematic review, if AI-enabled decisions are perceived to be unfair, users are more likely to show resentment and then less likely to actually adopt said technology. Gen AI can incorporate biases that exist in training data, thus imposing ethical risk for the organizations that adopt this technology. O'Neill refers to this as weapons of math destruction, biased training data and algorithms that in the long run increase inequalities. Oops. Forgive that, but you can just listen to me. Large-scale surveys of internet users indicate that users are highly concerned about their privacy and the collection of their personal information. Empirical work has also shown that there's a strong positive correlation between privacy concerns and predictive behavior. To this end, there have been some strong protective legislations, such as the EU's General Data Protection Regulation and the California Privacy Rights Act. This brings us to the catch-22, right? To truly unlock the potential of AI, the data sets that are trained ought to be reflective of the breadth of human knowledge and experience. In direct contrast to this vision is the protection and enacted privacy of one's digital data, an asset that's a valued and traded commodity, but that is ripe for exploitation. Gen AI models in their user-facing platforms have the ability to function as closed systems, which means then they cannot be used to further train the AI models. While this is an educated decision meant to protect our data, it results in a catch-22 situation in which the AI models then retain their original homogeneity of training. What I've described here is an inherent catch-22, but other scholars have deemed this as a principled conflict, a conflict between privacy and fairness. As a result, this is probably not going to be the last time you'll be hearing anybody speak about this. This is expected to dominate the literature as a contentious issue in the near future. To further illustrate To further illustrate, this is a brief, I did a brief reading of the White House's AI action plan, and even in their document, within the first 2 pages, you can see a conflict between wanting to unregulate or remove regulatory barriers, as the previous speaker just mentioned, but also insisting that AI models must be free from ideological bias. Okay. So there are technical solutions. I won't go into it in too much detail because I'm sure many of you who have a technical background are perhaps familiar with this. But the 2 most popular ones are data perturbation techniques, which essentially means including noise in order to try and protect user privacy, and federated learning, which essentially is a way to decentralize the training process by using DL models across multiple sources of data without requiring data exchange and thereby reducing privacy risk. There are also policy solutions, if I can quickly, there you go. There are also policy solutions, of course, auditing practices by third-party users, and then mitigating automation bias with human oversight. So let's take a moment to relish the irony of recommending human interaction and intervention to mitigate bias in a technology that's meant to automate human thinking. There's also methods of categorizing AI systems by risk level and mandating transparency for Gen AI output. But of course, the most ideal is comprehensive AI regulatory framework, which unfortunately in the US is still at a patchwork approach. So what I would say is studying AI, working with it, attempting to regulate it is overwhelming, which is why we gather at forums such as these and talk about it, so we can tell ourselves, keep calm, carry on, doing research, and attempting to regulate. Thank you.
Thank you so much for your insightful presentation. So one important point you highlighted was the need for training data to be heterogeneous in order to mitigate bias in the data. Now, at the same time, I do think about another way of biases that can come up in the system. So it kind of emerges from how the AI tools are being used. Since AI tools are becoming more and more available and cost-effective to use, there are more chances of these individuals using them for racially biased contents, generating those contents, and then propagating that is becoming more and more easier to do that. And it's also not as easy to regulate or kind of avoid that propagation of it, since it's becoming more difficult to differentiate between fake and real content. So based on this, I would like to welcome Juba Santi, who will be speaking about racially biased AI uses. Her topic is AI as digital blackface, beyond representation, racialized AI, stereotypes, and policy imperatives for equity.
Thank you so much, Sadia. And good morning, everyone. Thank you. Good morning, everyone. First, I want to say thank you so much to the organizers for having me. My name is Juba Santi. I have a bachelor's in political science from the University at Albany and a master's in urban policy analysis and management from the New School. And today I want to focus on digital blackface and how cultural bias shows up in digital environments, and more importantly, how AI is accelerating those patterns. And this is not just a cultural issue, it's not just a technical issue, it kind of intersects in both areas, right? And that intersection is where policy has not really quite caught up yet to how to address those issues. So first I'll walk you through that first, digital blackface is not necessarily new. It's a long-standing pattern of racialized performance. And secondly, AI systems are scaling and automating those patterns, right? So the more use of AI, the more that this imagery becomes generated and accessible, around the globe. And then third, existing governments that we have is not necessarily equipped yet to address how we can address those biases and address those cultural harm. So the core question is, who gets to perform emotions online and at whose expense, right? So we look at various forms of GIFs, memes, and images constantly. And they've become a default language on the internet. But we rarely stop and ask ourselves, whose identity are we stepping into? And when and why do we use them? Digital spaces blur authorship and identity, and that blur is where the issues lie. So the definition, so what is digital blackface? At its core, digital blackface is Black imagery, expression, or cultural cues by non-Black users. And it often emphasizes exaggerated emotion. It functions as a kind of a performative identity, and most importantly, it's not just the usage of digital blackface that's concerning, it's also about how certain forms of expression become exaggerated, standardized, and normalized as kind of emotional shorthand online. So some historical context on digital blackface. It didn't come out of nowhere. It originates from minstrel traditions that relied on exaggerated caricature. It builds on older traditions of racialized performance, where exaggerated expressions were done for entertainment and built on distortion. And then, although these two things, digital blackface and more traditional blackface, are not necessarily the same thing, they are an underlying pattern of distortion for consumption that continues to persist. So the key takeaway is that technology evolves. However, the power dynamics that exist do not evolve. Online as a non-Black person, being used to relay exaggerated emotion or caricatures, or is a way to continue to spread cultural bias and perpetuate negative images. And so it's not about necessarily the use of those images, of those GIFs and those images, but how we're using, what is the context, what is the reason behind the use of them. And so from there, it goes from individual systems to platforms, right? So algorithms such as used on TikTok, Instagram, Twitter, these algorithms prioritize engagement and emotional intensity, right? So it's designed to drive racialized expression that'll lead to racialized expression that performs well, and then content that spreads without context. So because of that emotional intensity, that is what continues to drive the algorithm. So people, whether it's a positive or negative reaction to the particular content that's generated, people will engage with it more. There'll be more comments, there'll be more shares, there'll be more discussion around it, and that continues to amplify that, right? Those exaggerated expressions perform really well in that environment, and that allows it to become repeated and then eventually normalized, often without context. So with AI, so this is where AI kind of changes the game. AI generates synthetic racialized content. And so therefore, it's not just these things being created on an individual level, now they can be created and amplified on a systemic level. AI can produce synthetic racialized expressions without any real person behind them, right? And because AI is based on existing data and it already that existing data already contains bias, so it's using the person itself who's trying to generate that AI, including the use of the AI's data bias. It continues to generate and create more bias because of the original intention of the creation of that. And so it's harder to detect the origin and intent when the data is being generated on something that's already existing bias. And then more importantly, it begins to become even harder to detect the origin. As AI gets better and improves, it can be a little bit more difficult to see that, oh, this is not an actual person, this is AI. And like, how can you better determine if this is something that's actually a real video or if this is something that was generated through AI? So why does this matter? It reinforces stereotypes at scale. And then it normalizes distorted representations, and it obscures accountability. So the normalization, when it's constantly repeated, it starts to feel neutral or default. And when that content is synthetically or algorithmically surfaced, it becomes much harder to ask the question, who is responsible for this information? Who's responsible for the data that's being generated? And then this individual behavior starts to turn into systemic impact. Governance. So there is a gap in governance in terms of the existing policies addressing AI and cultural bias. As of now, the existing policies exist focus on safety and not necessarily representation. So companies like Meta and Google, they primarily focus on the safety and misinformation of AI and data, right? So they're focusing on whether something is actually true or not true, but not necessarily whether or not that information is addressing cultural representation or distortion. And then whenever there is some type of moderation, it tends to be reactive. For example, most recently, the family of Dr. Martin Luther King Jr. Had expressed backlash over the use of Dr. King's image in various derogatory ways being generated online through AI. And it led to companies like OpenAI implementing a policy that allowed for to prohibit the use of Dr. King's image to be used in like negative portrayals. And so, even though there's no clear standard yet of cultural harm for the use of digital blackface, widely accepted standards for what constitutes cultural harm are still a part of the systems and still looking to grow and develop within that. So, what are some opportunities to address cultural harm in digital AI? There are three areas that we can really focus on. First is transparency. We need more visibility into how training data is sourced and how systems are built. Are there ways that we can hold AI companies accountable for the outputs that those systems would generate? And then third is cultural governance. How can society adjust its behaviors to address this cultural bias? The policy that needs to emerge in order to address these ethical and cultural bias in AI. So the question is not whether AI policy exists. The question is whether we are willing to govern how it can be scaled. AI is not about creating new biases, right? It's about scaling the existing ones. And digital blackface is one example of a broader pattern where we continue to see these changes. So, with that being said, there's some academic research. One, I'm not going to go through everything, but I would say the one that's really interesting is the foundational concept of digital blackface, the repackaging of the black masculine image, and that is actually from 2006. So even back then, there was a discussion on the use of the black image and black masculinity and use of black images online, even going back to 2006. So that's a really great source to refer to. And that's it. Thank you so much.
Thank you so much for bringing up those really important points. So one point that Juba mentioned in her last slide was accountability. So however, AI systems are becoming more and more advanced and deeply embedded in our decision-making systems, and accountability itself is becoming more complex and somewhat evolving in nature. And to speak about this, I would like to welcome Professor Mila Gasco-Hernandez. Her topic is accountability in the age of AI-based automated decision-making, identifying the risks and recommending ways to address them.
Good morning, everyone. I guess, do we have the slides? I guess CTG is striking again. My name is Mila Casco Hernandez. I am an associate professor in the Department of Public Administration and Policy at the University at Albany. I am also the research director of the Center for Technology in Government, and I am also the interim associate director of the AI and Society College at the University at Albany. Thank you very much, Rockefeller Institute of Government, AI and Society Research Center, for your invitation. I was here yesterday talking about AI. I am here again today, and we have this saying in Spain that once you do something twice, definitely you are going to do it for a third time. So, Laura, I think that tomorrow I'm going to be here talking about AI as well. So today I'm going to, I hope that everybody, I am short, so I hope that everybody sees me well, but today I'm going to talk about accountability. Those of you who know me, you know that usually I present results and findings from my research projects. Today, I am going to do something different. I am going to present to you the framework that guides the research that we do at CTG when it comes to AI, and particularly when we do research about AI and its impact in public value. So bear with me. These are not empirical results about anything, but this is our thinking about AI and public values, and particularly about accountability. I am also presenting on behalf of my co-author, Ramon Gil Garcia, who is a professor as well in the Department of Public Administration and Policy and our director at CTG. We have been talking all morning long about how AI is expanding in public organizations. AI is used in many areas, in many fields, and clearly public organizations are more and more using AI. And we do know, we have also talked about that AI can bring important benefits, but clearly it can also bring important risks. And I think that my colleagues before have talked about different types of risks. They've talked about environmental justice, data privacy, data bias, and in the end, all of them are related to harms and to changes in public values, not only from a negative point of view, but also from a dynamic, if you will, point of view. AI changes the dynamics of public values, and given that today I am talking about accountability, AI changes the dynamics of accountability. Now, this is not new. Technology-driven change, organizational change for that matter in public organizations have always resulted in changes in accountability. So in the age of AI, clearly this also applies. If we want to become a little more conceptual, at its core, if you will, accountability is about elected officials, public servants' obligation about informing, about explaining and justifying their decisions and their actions. But the answers to questions such as who to hold accountable and by whom, what for or why, they are shaped by the institutional arrangements of every different moment. So for example, if we go back to the very beginning of public administration, when we had these traditional public administrations conceptualized by Max Weber, mainly accountability was vertical accountability, and it was based on principal-agent relationships. As we transition in public administration, and of course I am an academic, so I am simplifying reality, right? But as we transition to new public management, to even new public governance, the number of actors that hold governments accountable increase. And we start talking about horizontal accountability, even diagonal accountability. Again, this is also truth in the age of AI. But our argument is that in the age of AI, there are a few additional changes that make things a little more complicated and a little more different, if you will. And I would like to highlight a couple of them. The first one is that AI is replacing, and I know it's not happening everywhere and drastically, right? But let's put it that way. AI may replace street-level bureaucrats who make decisions about public services. And therefore, these street-level bureaucrats, and we define street-level bureaucrats as those public servants who interact with the citizens, they lose discretion about that decision-making process. And not only that, we can say that there is also a change in power. That power that was that belonged before to street-level bureaucrats is now changing to machines. And of course, this is like a kind of a utopia, but I would say it's changing to AI developers, and it's also changing to agency-level decision makers. The second change that makes things a little different is, and it is kind of related to the first one, is that now these AI tools are developed, or I will put it in a different way. The development of this AI tool entails different stakeholders, different actors. And so as we were saying before, and some of you already pointed to that this morning in the first panel, this means that there is no single person who can be accountable any longer. In the end, everyone participating in the process has some sort of responsibility. AI developers have the responsibility of the technical tool, of the code, of the algorithm. The public servant, him or herself, has the responsibility of using ethically and responsible AI. And policymakers have the responsibility of coming up with that regulation, with those frameworks, with those governance frameworks that are going to guide the use of AI. So in the end, that accountability is spread through different stakeholders and through different layers. And clearly, those questions, right, that I was posing before become more complicated. We have new questions, if you will. What should be transparent? And I bring transparency to the table because from my point of view, transparency and accountability are only two sides of the same coin. So you do need to be transparent in order to be able to be held accountable. But then who should be held accountable? Now that everybody has so many responsibilities in this process. So yes, everything that we learned in the past applies, but there are new thoughts. I don't know how to put it. It's not new thoughts. There are new things that we need to think about when it comes to accountability in the age of AI. When I was preparing this presentation, I realized I had been super ambitious when you asked me what the title of your presentation is going to be. And I told her, I am going to give you recommendations about how to deal with this problem. Of course, I cannot do that, right? So I'm going just I'm just going to list here a few of the things that I believe, again, we need to think about to be able to address these risks and to be able to safeguard accountability. That's the word or the concept that I like to use, to safeguard accountability, to make sure that governments are still being held accountable, regardless of how they make decisions. If it's with AI, it is with AI, but they are still held accountable. Some of these solutions here have already been discussed this morning, so I am not going to go through all of them, but I would like to highlight a few things. 2 minutes. The first one is about transparency, and I have introduced that question before. I do think we need to change the mentality about transparency, and I would like to claim that we need to go from the show me the code mentality to real transparency, to the technical explainability, to the institutional accountability. What does that mean for me? We need to tell the citizens who is developing the systems. Is AI being used in a decision-making process? What data is being used? Is this data including data from all communities? For example, marginalized communities, which is going to give us an idea of the bias of this data. Where does the data come from? Very important, what are the mechanisms to challenge a decision? And what processes are in place to challenge those decisions? That's the type of transparency I believe public organizations need, particularly when they are talking about the public. Otherwise, the public don't really understand. The public knows that Siri might be AI, that there are electric vehicles. They don't really understand what it means to make a decision based on an AI system. And so we need to provide them that type of transparency that they are able to understand. Establish hard guardrails. There is this author, Jonathan Fox, who's written a lot about accountability, and he differentiates between soft and hard accountability. Hard accountability is the accountability that is there when there is enforcement. It doesn't matter if we have lots of legislation pieces, if we have a lot of regulation, if that is not enforced. And enforcement means punishment. You are not doing this, there is a consequence. So hard guardrails, it is important. And also for IT vendors, and we have discussed IT vendors as well. Although I also want to say that this is, again, not new. Public organizations have been dependent on IT vendors for a very long time. Outsourcing is something that public organizations have done for a long time, not only about technology. Accounting, HR functions have been outsourced in the past. So we have lessons to learn from the past, but clearly in the age of AI, we need to do something else. Organizational capacity, and my perception is this is not only about training, this is not only about education. Organizational capacity is much more. It is about resources in general, management systems, knowledge and learning processes, and collaboration, because AI is collaborative in nature. So we do need to have all those dimensions well thought to be able to implement these safeguards to accountability. And again, I want to emphasize this is not only about training, or this is not only about education. I am going to start a paper with my colleague here in the room about how AI changes tasks, changes skills, and when doing so, how AI challenges professional identity of public servants. And this is key. It is not only about telling them what AI can do and how they can use ChatGPT, Microsoft, Copilot, Gemini, you name it, to do something. There are implications about the use of AI. And I'll go very quickly because Sari is looking at me like you have to finish, Mila. I'll go very, very quickly to my favorite one, engage the community. Derek is very shy, and he didn't really say anything about that. But our cut is going to be successful because it's going to engage the community. It's going to take into account marginalized communities. They're not going to feel surveyed because they are going to come to not to CTG, they're going to come to public libraries, a safe and trusted institution for communities, and together with us and with Schenectady and all other governments that are involved, they are going to tell us how they feel about the use of this AI-based tool. Engaging the communities in decision-making processes is key, and we always forget about them. And I know that maybe there is not a long tradition. I come from Europe, I come from Spain, where community engagement is key when it comes to government, co-production is key when it comes to government, but it is possible. It is possible to ask our communities, what do you want, how do you want things, and what is your input, so we can address their concerns about the use of AI by governments. And I will leave it here. Thank you so much.
Thank you to our panelists for these amazing presentations. Unfortunately, we don't have time for quick Q&A. We're at time at 12 o'clock, so please feel free to connect with them during lunch and ask questions if you have towards them. Thank you so much.
I want to say thank you so much to our panelists. I'm sorry that we ran so close on time, but we got to hear so many of their incredible thoughts and work and experience. So I'm so appreciative of that, and I hope that you all take the opportunity to connect with them through the lunchtime period. I want to thank our other panel as well, and our moderators from the morning, who are just wonderful. We are going to have lunch now. I want to note that the keynote is scheduled to begin at 12:25. So please, without causing a stampede, if everybody could try to go get themselves lunch, take care of whatever they need to, and try to be back for that. I'd appreciate it. Thank you so much, and welcome to lunch. Ooh, did we switch it off? No. Great. Ahead of the introduction of our keynote, I just want to briefly bring up our incredible collaborators at the AI and Society Research Center. So I'd like to introduce Elizabeth Gray, as I noted earlier. She's the Associate Director for Operations, Strategy, and Engagement at the center. Welcome.
Hi, everybody. Good afternoon. First, what an amazing start to the day. Thank you to all of the panelists and moderators and participants for the first part of the day. This has really been great. We're really just so pleased to be here and to have been a part of making this important conversation happen with the AI and Society Research Center. I want to just start by offering some words of thanks. First to SUNY, who the investment from SUNY is what made the AI and Society Research Center possible. That's what brought the center to life. And really, the structure of SUNY supports so much of the work that we do, and of course, the Rockefeller Institute as well. So many thanks to SUNY. I also want to thank my colleagues at the AI and Society College, Mila Gasco-Hernandez, who presented earlier today, and our colleagues at the college work on the pedagogical and curricular side of the work that we do. And so thanks to Mila and our colleagues there for their work. And of course, very special thanks to our colleagues here at the Rockefeller Institute of Government, who did really all of the really hard work of making this event happen today and having it run so smoothly. So you guys have been so wonderful to work with, and we really see this as part of a very long collaboration around these themes. So the AI and Society Research Center is really new, and so I wanted to just take a quick opportunity to tell y'all a little bit about what we do. Our aim is to bring together researchers from the humanities, the social sciences, and the arts into direct dialogue with those who are working in the technical fields. We want to look at the ethical and human and social dimensions of AI, and not as an afterthought, but looking at it as central to how those systems are developed and deployed and governed. And our mission's connected to a lot of something that's come up a lot today, which is that the challenges that we're grappling with are not entirely new challenges. These questions of bias and access and power and misinformation are really long-standing issues that are embedded in the economic and social and political context of our world. And we're also engaging with the proliferation of AI with some of these deeper questions of knowledge and interpretation and what do we even mean by a mind or intelligence. And we're seeing these in new ways, but they're long questions. And so on these questions, the arts and the humanities and the social sciences really have a lot to offer and a long scholarly history that can bring a lot to the table. And of course, the challenges, but at the same time, AI is bringing real opportunities. And we have this chance to, improve public services and strengthen healthcare and improve education, support better decision-making, and in all of these ways that have real potential to improve human lives in the broader world like never before. And so at the center, we aim to engage in both the promise and the perils of AI, and looking to explore how we can take advantage of those opportunities without turning away from those risks and those challenges, and engaging with them in a way that gives appropriate nuance and balance to both sides of that question. Holding that tension is really core to what we do at the center. And what is new, of course, is the scale and the scope and the speed at which we're dealing with all of these issues. And the stakes are real, and the level at which we're dealing with it, the intensity, is really unprecedented. And as many of you on the policy and practitioner side of this are acutely aware, this is playing out real time every day in these policy and practical ways that we really need the information and the conversation and the space to have these conversations to deal with the many sides of this question. So that's why we see convenings like this to be so important. So researchers, like we bring from the University at Albany, alongside policymakers and practitioners, each bring something essential and distinctive to the conversation. And when these perspectives inform each other, when we're engaging with the real world conditions and dealing with all of the messiness and complexity of the in-the-weeds reality, and having these conversations over time in an iterative way, in real, serious dialogue, I think together we can make meaningful and actionable progress on some of these really urgent questions. And so that collaboration is what we're here to build. That's what we're hoping to continue building with the Rockefeller Institute of Government, and that's what we're all here doing today. So we just want to thank you all so much for participating in this, and we hope to continue this conversation going forward. Thank you.
Thank you. And now I want to bring up our president of the Rockefeller Institute, Bob Magna. Among his many other former illustrious titles, he was the budget director for the state of New York. We are lucky to have him here with us today, wherever he wandered off to. I see him. Welcome up, Bob. Thank you.
I'm Bob Magna. In case that wasn't clear, I'm president of the Rockefeller Institute of Government. I want to thank everyone for coming today. I also want to do a quick shout out to the Rockefeller staff who have helped put this event together and have staffed it. So I know we have two folks in the back, Michelle and Joel. We should applaud for them. And there's plenty of other folks, including the folks downstairs and throughout, who have been helpful in putting this together, including the folks from Albany. Do I have to thank them? I guess I have to thank them, including the fact that I would tell our next guest, who I'm really pleased to introduce, that she goes, if you look at her resume, which is, pretty interesting and impressive, that she has now entered the Smallbany space, where often folks throwing events from two different places are actually married to each other. Again, I'm Bob Magna, president of Rockefeller. I'm happy to be here today. This is a great event. We have so many people. I think it's wonderful. And we have a great keynote speaker. She is the new Chief AI Officer, Eleanor Fournier-Toombs, who oversees the responsible deployment and risk management of AI across New York State. I always love reading stuff like that. I'm sure she'll tell you what she really does. Her background is very impressive. She's previously served as a senior data scientist in the private sector and held leadership roles across the UN Secretariat, very impressive, at UNDP, the World Bank, and OCHA. More recently, she served as head of anticipatory action and innovation and senior researcher for the United Nations University. Hopefully she'll explain to us what that is, where she founded and led the UN's first AI policy research lab. But we're not here to hear from me, we're here to hear from Eleanor. So Eleanor, why don't you come on?
Hi everyone, great to be here. Thank you for the lovely introduction. I'll try to explain some of those fancy terms. And it's great to be part of this conversation. I heard some of the previous panels, and I really feel that what I wanted to talk about really builds upon a lot of what you've heard previously. Of course, I want to talk about the use of AI in government. I think that's clear. But I want to take advantage of this academic setting also to talk about the governance of AI and a little bit, maybe go into a little bit more of a deep level. So not just telling you about the great things that we're doing, but also talk a little bit more about some of the rationale and the understanding and maybe even the ethical and philosophical perspectives of what it really means to govern AI. So Yes, I have a background largely at the UN. I worked as a data scientist in predictive analytics, so using kind of early AI machine learning to predict crises. So during COVID-19, we did a lot of work on the spread and the severity of the virus in countries already experiencing humanitarian crises, like Yemen, Haiti, Iraq. We also did something called compound risk modeling, which was around if there's a natural disaster and there's a conflict, so a drought and a conflict, and then you have COVID-19. What are you going to do? Who's going to be most impacted? And how are you going to deliver services effectively or humanitarian aid effectively? And so there's a lot of parallel between that work at a global level and a lot of the work that we're doing here in New York State. And since then, I did work a lot on global AI governance, and one of the areas of work is to try to figure out the impact of AI on pre-existing goals and objectives, like human rights, sustainable development. And the other part was trying to figure out what could the member states of the UN agree on when it comes to globally governing AI. And what they could agree on is the creation of an international scientific panel on AI, which is something. It's similar to the Intergovernmental Panel on Climate Change. And basically, it aims to provide scientific consensus on what AI is, what are the risks, and what are the opportunities from a global perspective. So making sure that all the perspectives are heard. And they're going to, of course, produce a report. I've written a lot of reports. Apparently, no one reads them, but I think people here read them. And now at the Chief AI Office, we do indeed do responsible AI deployment. What does that really mean in practice? So we have 3 pillars. One pillar of work is around the deployment of AI tools. So we've deployed a generative AI tool actually in early April after a proof of concept across New York State agencies, and to enable agencies and state workers to best utilize the benefits of AI to help their work. We have a governance stream, which is currently developed with our program director, who's here, who's Dana Rosenstreich. Oh, you're here. To really work through developing policies, supporting the governance team and policymakers on policy, and also implementing. And so I'm going to try to address a little bit of that, because the implementation of policy from a technical perspective and from a big kind of decentralized agency perspective is actually quite complicated. And then we have the training component. So we're also responsible for finding a way to upskill state workers, helping to educate them in terms of AI literacy, AI ethics, how to best utilize these tools, and how also to not utilize these tools. What's been really interesting for me in the various positions that I've held recently is that deploying AI in a government or an international context is largely high risk. It's high risk because the beneficiaries, the people that are going to be impacted, are always receiving services. It's always AI touching people's well-being. In the case of the UN, it was a lot of people that are refugees and migrants and in positions of vulnerability. But in here, it's people that are, receiving government services. How are we deploying AI in our schools? It's touching our children. So every time, it's intimate, kind of personal impacts that people have when AI tools are deployed. And in a positive way, it can have a really big impact. So we all know that there's a huge backlog in the state. There's a lot of services that could be improved. There's a lot of ways in all of our lives could be improved if we find a good way to use AI tools. But the other side of that is that if we do it in the wrong way, the impact could be significant. And so my approach and our team's approach is always think about the fact that, yes, we're deploying high-risk tools. Because we call them high risk doesn't mean that we can't deploy them, but it certainly does mean that we need to do due diligence. And we're in a state where there's 19 million residents, so it's extremely large. We have a lot of thought leadership also. There's many thought leaders here present. There's one of the original writers on data science ethics, which was Cathy O'Neill, started a lot of these conversations in New York I'm sure, I don't know who's read that book, but that was like kind of the first AI ethics book. And there's thought leaders at SUNY, at NYU, and I feel like the population of New York State is very educated when it comes to the risks and the opportunities. There's a lot of civil society engagement, there's journalistic engagement, and the policymakers are also required or asked by their constituents to think through the impacts of AI. At the same time, as I've mentioned, we really have this drive and pressure even, whether it's policymakers, whether it's our chief information officer, whether it's our team, to find ways to reduce bureaucratic friction, improve the delivery of services, be more effective, and also the accountability from a taxpayer perspective. So make sure that tax money is spent as effectively as possible. So that dual pressure was referred to earlier, and certainly we have a certain tension in the work that we do. But coming into this a few months ago, in my case I started in January, so it's relatively recent, there was already a policy foundation. So in New York State, I think many of you are aware, we have an acceptable use of AI policy, which is the internal facing regulation for the government's own use of AI. And it was published in 2024, and it's principles based. So basically it includes a series of principles that need to be taken into account when an agency is deploying a use of AI. So the risk model for New York State is a decentralized risk model, which means that I'm personally not responsible from a risk perspective for every agency's use of AI. They are responsible, each agency is a risk owner, and the chief AI officer or office is a coordination function. So we make sure that we have an implementation process in place, that every agency is conducting their due diligence, that they're reporting back their due diligence. And some of the areas where we're trying to support them are the principles that are set in the acceptable use of AI policy. And I want to talk about a few of them. So we have, for example, human oversight, transparency, fairness and equity. And we have a requirement now to publish, so to publicly disclose public-facing uses of AI in the AI inventory. And so every December, you'll see, we did it December 31st, but this year we're going to do it earlier. That was not a good date. December 15th at the latest. We have the AI inventory. And so every resident of New York State is able to see what are the AI tools that are deployed that are public-facing, which I think is important. So the question of human oversight is, to me, extremely interesting because there's a lot of different levels to this. One of the levels is the question of human in the loop. So the loop, in this case, is an AI life cycle. So just like a project life cycle, AI tools have a life cycle as well. So it includes design of the tool, training data set, training the model itself, testing the tool, and then deploying it and monitoring. So that is the loop. And so in a human in the loop concept, you need to have people engaged in decision making around at every step of the AI lifecycle. And the way that you check this is that you conduct kind of checklists and procedures to make sure that there's people involved at every step. And it's a very important concept. There's another area of human in the loop or human oversight, which is automated decision making. So in New York State, there's no decision-making impacting the public that is automated without a human being able to make that decision and that final determination. And that is actually not the case in every government. So there's some governments that have, for example, Canada, had an automated decision-making system to automatically vet visa applications. So people would apply, and then it could go through a process, and then whether or not that person gets a visa gets approved. It was in place a couple of years ago. And what was, of course, problematic and emerged is the question of bias, and particularly unintentional bias. So the issue was that over time, the model started excluding groups of population accidentally, because these models kind of creep a little bit and can move around. And so that came out in the news, and there had to be a lot of adjustment. And one of the important principles is this question of always making sure that the determination is, of course, done by a person. But what's interesting here is that the question of this kind of intuitive aversion, so I think when I talk about AI making decisions for us in terms of the delivery of services, most people don't want that. I don't know anybody who really actually does want that. I haven't met that person yet. But if I tell you that the AI tool is never going to make an error and not going to be biased, I think you still don't want it. And I find that very interesting to think about. There's been a lot of research done about this. So in the UK, the Ada Lovelace Research Institute, which is a lot on AI and society, they found that the majority of respondents don't want AI tools to make a decision on welfare eligibility, for example. And the Searchlight Institute also found that 77% of Americans don't want AI involved in judging criminal trials. I think we all agree. I mean, none of us are going to disagree with that. So why is that? One kind of first level is the question of bias. So, and that is addressed in terms of fairness and equity. So when you talk about bias, you have 3 different layers. The first one is discrimination. So an AI tool that is making a decision based on, and has an output that is different for certain groups of the population. Then you have stereotyping. So stereotyping is when an AI tool propagates ideas, and this is particularly the case for generative AI, propagates ideas that are inferior or that are harmful about a certain group of population. And finally, you have exclusion. So when certain groups of the population are just not involved when it comes to the design of the tool and access to the tool. But there's another area and a kind of level of this. And that's more around self-determination and authenticity. And I find this incredibly interesting. So people want to feel like they have self-determination when it comes to AI. They want to know that the people that are making decisions is either themselves or people that have a shared lived experience. So they want to know that it's New York State residents that are making that decision. They also pay taxes. They also have the same services towards them. They're potentially friends. They're potentially family. They have that shared experience so that we feel that we are determining ourselves and deciding ourselves what our society will be like, and not a technology that's going to do that. Similarly, there's the question of authenticity. So authenticity is the level at which a political representative is genuine when they are stating their values and their objectives. And so if you think about the way in which New York State works, you have the political representatives that are elected, and then they, to a certain extent, give us our agenda as state workers. And so we're accountable to them, and they're accountable to voters. And when an AI tool comes in the mix, the AI tool is actually not accountable to the same extent, right? And so that is not a representative that was elected. That is not a person that was delegated by the representative, by the representatives themselves. That those are tools that are trained by other people that have other motives and objectives. And so people feel that there's a real tension between this idea of self-determination and then the idea of technological determinism, which is the idea that a technological tool will start shaping society and shaping the outcomes of the place we live in. And so those are the kind of foundational and like deeper ideas that emerge in something like an acceptable use of AI policy. And I feel like it makes it much more interesting to read if you know that there's actually such kind of deep philosophical and moral perspectives on how you're really going to govern AI in terms of people's preferences, people's instincts, and the way in which we all want to operate in a society. So I'm not here only to talk about this. We actually have a lot of work in our team to take these policy ideas and to implement them. So I will briefly touch on that. one of the first things that we were asked to do is implement the acceptable use of AI policy. And so what we did, so we had these principles and say, how do you actually do anything about that? So the first thing that we did is we put out a handbook. It's 25 pages, it's very long. And it's basically a series of checklists. So the first thing that you want to do if you want to deploy an AI tool and you think it's useful, because a lot of people that work in the state will think, this is going to be really helpful. I really want to use this tool. It's going to help me in my job. It's going to help what the mission that we're trying to accomplish here. So first, you need to determine what is the risk level of your tool. And we have these detailed checklists that you go through to decide, is it a low-risk tool, is it a medium-risk tool, or is it a high-risk tool? And the risk-based approach is very common. It's from many, many policy instruments. Take a risk-based approach to AI, with the idea that the higher-risk tools will have a more thorough due diligence, and the low-risk tools, you can pass them a little bit more quickly. So if you have a medium or a high-risk tool, then you go through more checklists to go through human oversight, transparency, fairness and equity, data protection risk, intellectual property. So different things that you need to start checking. And so you say, okay, so I'm looking at human in the loop, so I need to see, is there somebody who's actually validating this information? Is the AI tool actually providing a recommendation, and could that recommendation really impact the decision of somebody? So that maybe that's not optimal. Is it, on the other hand, is it maybe just checking when people are submitting a form, is it checking that that form is complete? So maybe a more optimal or desirable use of AI. So you kind of sort through in your mind, and you go through your checklist how the AI tool is really going to be used. And that's basically the main level of implementation. So once the checklists have all been conducted, you get to a part of recommendations. So what are the recommendations that are made to mitigate that risk? Once you do that, you try to mitigate that risk. And as an agency, you try to evaluate, does the risk outweigh the benefits? If the risk outweigh the benefits, then you don't deploy it. If the benefits outweigh the risks, then you start going through the process of potentially procuring your tool. And we're trying to figure out the balance. We are not a very big team, but we're trying to figure out the balance of actually supporting the different agencies in helping them with the recommendations, giving them maybe more official advice on where they should go with these tools, so that there's a certain level of oversight and kind of mainstreaming of the different activities here, because it's actually a lot of procedural work, and we want to make sure that people are not losing track of the importance of what's being done. So our next step for us is going to be to turn this into a tool. So we want to have a governance dashboard for the state, and we're currently exploring different options for that, where basically every AI tool, you would be able to conduct your risk assessment within that dashboard in a maybe easier way than just a whole bunch of PDF and checklists, which nobody really loves. And then you could have a little bit of education and information. What proofs would you need to provide? What kind of information? Do you need to do an analysis of your data set to see if it's representative? How would you do that? And you have all of that in a dashboard. And so from a central perspective, the leadership knows, how many tools are deployed across New York State, which they do know, but like as more AI tools are going to be deployed, it's going to be potentially bigger volumes. Are there any high-risk deployments? How are those risks mitigated? How are those risks communicated? Are we sure that these are published in the AI inventory? And start tracking and monitoring the different uses of AI. So that's kind of the future for our team. And I really think that it's a very interesting opportunity to really make a difference in this space. And I really appreciate all of you here for making space, for having these kinds of conversations, especially at a deeper level. I know a lot of colleagues are actually here to try to learn more about the different layers of governance and policy and ethics and what it really means in order to be able to make the right decisions. So thank you so much for having me here, and I look forward to our conversations. Sure. 5 minutes? Oh, okay. I have 5 minutes for questions. Sure. I have one here and then one in the back.
Thank you so much for your presentation. It was really informative. I did want to ask about, so you have this guideline that you're providing to the, I'm assuming the agencies. How are you ensuring that they are adapting to this guideline? Are they using it? Is there a way you're keeping, I don't want to use the word a check on them, but are you kind of finding ways to make sure to know or hold them accountable for using these guidelines that you're presenting to them?
Of course. And it's a partnership also, right? Because anyone who's deploying AI tools in these contexts, they really want to have the tools to be able to make an evaluation and show that they've done the due diligence. So it's not, our office kind of imposing these regulations. It's more of a partnership. The way in which things are structured is that every agency has an IT team from our ITS office called the Deputy Commissioner of Technology. And that is our entry point for every single agency. So there's approximately 30 of them. And so we've met with them, we communicate with them directly when we're developing these new tools. And as much as we have the capacity to, provide them with support. So some of the agencies at the moment, we're giving them kind of direct support where we're helping them to do the analysis, trying to give them specific recommendations. And over time, we'll have a little bit more capacity to do more. And I also think that we might prioritize the ones that are more challenging analyses or higher risk analyses, then we'd be more involved. And if the agency can
how it's documented, how it's implemented, and whether it's inward-facing, like toward legislators and legislative staff, or public-facing, what is on the state's roadmap for leveraging AI to support more effective and transparent navigation of complex and impactful things like legislation and regulations, for that matter?
So how would AI be used to help the public understand public-facing legislation?
And the legislators themselves. I mean, I have some ideas on how, but
Yeah.
is it on the agenda, I guess is what I'm saying. And if it is, then how? Yeah.
It's certainly been raised a lot. I think we have two tools that are being provided to the agencies that might be used for that. One of them is our generative AI tool, the just kind of basic, it's based on Gemini. And that can help, so we are trying to see the extent to which that can be used to support, for example, the creation of chatbots. So the public-facing chatbots to dialogue with content from the state is one of the areas that we're exploring. Another tool that we provide is more of an analytical tool. It's based on a research tool called Notebook LM, and it provides maybe more in depth than just a kind of chat prompting, and that is also being used internally by a lot of analytical teams. So that's is not necessarily public-facing now, but it is used internally. So state workers have so much work to do in terms of just going through policies and making sure they're compliant. And so there's certain teams that are, that's one of our big use cases, is analyzing policies and figuring out, summarizing what needs to be the next steps. But the public-facing chatbots is something that we're certainly thinking about. And there could be other types of AI also that could be used in the future. So happy to hear about your ideas too.
I think you mentioned a bit of it. I mean, the idea would be to augment a robust LLM with a corpus of, right, and to put some guardrails around it. And it seems like it's doable, and it seems like it would make lives a lot easier. And this is, again, just even thinking inward-facing into government, but then to turn that around and to make such tools available, because nobody can read a law. I mean, you can, but you know, you've got to go you've got to trace things back. Anyway, blah, blah, blah. Excellent. That's really good to hear. And I've been nominated to carry the microphone to the next speaker, so.
Okay,
question.
one more question. One more. Sure.
Hi, I'm Jada. I'm a senior research AI scientist from the New York State Department of Health. So my team works close with the ITS team, and I really like your idea. It's about like the decentralized AI risk. So for that concept, I'm wondering what the flow will be look like, and especially when we work closely with you, with your ITS team, and how do we figure out the accountability of the risk if we have from your side and from our local department side, agency side. Yeah.
Could you repeat the last part of your question? What?
I mean, how to figure out the risk accountability,
okay,
and from your side, ITS side, and also our agency side.
Right.
And that's kind of like, yeah.
Yeah.
Thank you.
So it is a complex question, and we are figuring it out. The way that it is set up is that the agency is the deployer. So the agency is responsible for accepting the risk or not accepting the risk, and it has to be that way because they're the ones who understand exactly the subject that they're deploying the AI tool in. If it's the AI office, it will be a huge bottleneck and also potentially not accurate. So I do see this model continuing moving forward, so the accountability would go to the agency. Where the AI office would be held accountable, I think, is whether we provided the right tools, whether we, in high-risk cases, did we provide any opinion or advice or support if they asked for support? Those kinds of questions from a process perspective. We would certainly be held accountable for that. But if the agency does their due diligence and determines that they're going to deploy the tool, they should be the ones that are held accountable and kind of the risk owners of that tool.
Okay, thank you.
Okay. Thank you, everyone.
I just want to say thank you so much to our Chief AI Officer again for such a wonderful talk and so much real thought and reflection about how New York State itself is starting to implement and co-shape policy and implementation around AI. I want to now introduce the moderator for our third panel, who I'm lucky enough to work with here at Rockefeller. Courtney Burke, among the many impressive hats she has worn, is a senior fellow for health policy here at Rockefeller. She has served in a number of high-ranking positions in state government, healthcare organizations, boards, including Chief Operating and Innovations Officer for the Healthcare Association of New York State, Senior Vice President and Chief Strategy Officer for Albany Medical Center here in town, as well as New York State's Deputy Secretary for Health and Commissioner of OPWDD. So I want to thank her and welcome her, welcome up the third panel as well to take their seats.
Got one more, hopefully. Oh, there we go. Making sure we're all set logistically. Thumbs up? Okay, great. Well, good afternoon, everyone, and thank you, Laura, for the introduction. It is a pleasure to work with you as well and the many talented people here at Rockefeller. And I always want to thank the folks who help organize these things. So I'm Courtney Burke, as Laura mentioned, a senior fellow in healthcare policy here at the Rockefeller Institute of Government. And I'm going to introduce our panel in just 1 second. But just to open things up, I wanted to give a few remarks because it's amazing to me looking back at a blog that I did in 2023, 3 years ago, about AI in healthcare and the considerations for policymakers at that point in time, and to see how far we've come. You know, I highlighted a few things that you would expect would be issues in healthcare, like privacy, for example, bias and equity in how algorithms are made, what the impact would be on the workforce. But to hear that keynote was really great, to hear about the things that the state is considering in terms of authenticity of these tools and issues with self-determination about it. It's really great to hear. So when I wrote that blog in 2023, it was so interesting because I work during the daytime as a consultant in healthcare, and we work with all different types of clients, hospitals, home care providers, insurance companies, technology startup companies, and everybody was talking about AI at the time, and it was overwhelming in many ways. And I think what's nice about today's panel is you're going to hear three very different perspectives, and I love the way that this is turned out. But I've started to categorize the uses of AI in healthcare in my own mind into two big buckets. One is obviously the clinical uses of AI, which is fascinating because being able to have that much data about the human body and mind and using it for diagnostics and new cures and all of that is just phenomenal. So that's one area, but there are so many other ways that AI comes into clinical use, that ambient listening for doctors, for example, just a general decision support. And it's relevant to everybody in this room because we're all patients. And so I know a lot of people who are going into their doctors with all this information overwhelming their doctors now. So a lot of companies are looking at how do they create tools for the doctors to be able to handle all the information that their patients come in with. So that's the clinical side, and then there's the administrative side. There's a lot of administration in healthcare, a lot of paperwork. So there's tremendous opportunity for streamlining things administratively, whether it's prior authorization, whether it's eligibility for programs. So that's how I've sort of segmented it in my mind, but I'd be open to hear if there's other ways of doing it as we think about it during today's panel. So with that, I'm going to open it up, and we're going to hear from each one of the panelists. And I may have one or two questions for each one of them when they finish, but we want to make sure we get to everybody. So we're not going to dwell too long. And then we'll do some more general questions at the end, because we have, I think, until 10 after, or 20 after 2. Okay. So I'll introduce them in the order that they're speaking today. And we'll start with Obat Chian. She's an assistant professor at the Department of Health Policy, Management, and Behavior at the School of Integrated Health Sciences. And she also is a Nathan Fellow here at the Rockefeller Institute. Mariana Spanicki-Varlas, I hope I said that correctly. She is a professor of neurology at Albany Medical Center, so a really interesting on-the-ground view of how things are being applied here and now in healthcare and some of the issues with governance and so on. And then Sally Dreslin, who works as the executive director for Step 2 Policy Project. And Sally has worked in government in very high-level positions in healthcare. We worked together at one point in time, some of the fondest years of my career. And she's going to talk about a really interesting idea and proposal around the role of government and how government might interact with the governance and oversight of AI. So with that, Obet, I'm going to turn over to you.
Thank you so much, Courtney. Good afternoon, everyone. I'm Obet Chan, assistant professor at the Department of Health Policy, Management, Behavior, Albany, and I'm Nathan Fellows here at Rockefeller Institute of Government. So today I would like to talk about my recent projects entitled, Does Artificial Intelligence Adoptions Improve Performance in Public Service Delivery? Evidence from U.S. Hospital. So as we all know, among public service organizations, U.S. hospitals lead AI adoptions in their managerial practices to optimize their resources and increase their internal efficiencies and address complex patients' needs. Despite this trend, we realize that there is a very lack of evidence using nationwide data sets to study on where hospitals are actually deploying the AI in their management and whether these AI adoptions actually improve their performance in many aspects. So here we would like to examine how hospitals adopt AI across the various managerial practices and explore the impact of AI adoptions on key hospital performance metrics, including clinical outcomes, patient satisfaction, patient safety, and cost efficiency. Particularly based on goal conflict theory, we would like to hypothesize that the effect of AI adoption may not be uniformly across those dimensions. Because if you think about the hospitals operate under the resource constraint, so they have to prioritize which goal comes first. So we thinking that when hospitals prioritize among the goals, there could be the kind of trade-off relationship between internal efficiencies and external effectiveness. For example, like internal cost efficiency versus patient-centered outcomes like patient satisfaction and patient safety. So to answer this question, I'm sorry. We use two data sets. The first one is American Hospital Association annual survey data. This data set is great because it provides a lot of different hospital characteristics and AI adoptions across all hospitals in United States. And we found out that the response rate about the half is like 49%. So we can collect about 3,000 hospitals per year regarding the AI adoptions patterns in their hospital. And second data set is the CMS hospital value-based purchasing program data. This data is also great to get some standardized performance indicators, which is applicable to the old hospitals. And it also provides a lot of key different performance indicators. So we used this data set and merged them all together. Because there are half of hospitals are eligible for value-based purchasing programs, so our final sample includes about 1,500 hospitals per year. So when we started this research, the most recent year data sets for both of them are 2023. So we collected 2022 and 2023 for 2 years data and conducted the cross-sectional analysis. And for the analytical method, we use a pooled OLS, so with year and state fixed effects in here. And after this, working projects, we plan to expand more years to see the upcoming trend of the AI adoptions in hospital. So our independent variable is AI adoption. So as I said, that we use the American Hospital annual survey data because they have 5 different managerial categories regarding the AI adoption. So first one is predicting staffing needs, whether they use AI for forecasting workforce demand and anticipated staffing gap. And the second one is predicting patients' demand, whether they apply AI for forecasting patients' volumes and service utilization pattern. And third one is staff scheduling, how they use AI to generate and optimize shift assignments and staffing schedule. And the fourth one is automating routine tasks, like using AI to handle routine tasks such as documentations, paperwork, and scheduling reminders for the patients. And the fifth one is optimizing administrative and clinical workflows. So it's actually asking how hospitals leverage AI to optimize end-to-end workflow across the operation. So in this study, we use each category as a binary measure because they ask this question like whether they adopt yes, 1, or not, 0. And we wanted to measure the breadth of the AI adoptions using the all category. So we measured the overall AI adoption operationalized as a count variable ranging from 0 to 5. And our dependent variable is hospital performance. So using hospital value-based purchasing data, we can measure the 5 different performance indicators ranging from 0 to 100 scale. The first one is clinical outcomes, including 30-day mortality and readmission rates. And the second is patient satisfaction. In this data set, they use a HCAP survey to include patient's experience, communication quality, and care coordination. And the third one is patient safety. In this data set, they use PSA 90 scores to capture patient safety events and adverse outcomes during the care. So it includes the hospital-related infection rate and falling. And the fourth one is the cost efficiency and cost reductions. It's measured as a Medicare spending per beneficiary. And using these 4 scales, we also include the total HBBP scores, which is composite scores made up of all 4 dimensions, each domain weighted equally at 25%. And in the model, we also control for hospital characteristics, financial sources, market conditions, and patient's characteristics. But if you have any question, I will come back here later. So let me briefly talk about our findings here. So first, we wanted to visualize the patterns of AI adoption across the management category. As you see here, you can see the percentage of AI adoptions across the hospitals, and the blue bars indicate 2022, and orange bars indicate 2023. So you can see some patterns in here. And the last bars indicates that whether hospitals adopt AI in any management categories in their system. And you can see that more than half of hospitals have adopted AI in at least one domain. And primarily, they are more interested in to adopt the AI for workforce optimization and routine task automations, whereas staff scheduling remains the least adopted categories in here. And what's going to be the impacts of AI adoptions across all performance indicators? Here we include the overall AI adoption, which is breadth of the adoptions across the hospitals. And we included this one in the full models. We found out that AI adoption increased clinical outcomes and cost efficiency. However, it's negatively associated with the patient satisfaction. So it means that it's actually support our hypothesis that there is some trade-off relationship between the conflicting goals. That AI adoption may be beneficial for clinical outcomes and cost efficiency. However, it comes at the expense of the patient safety. We wanted to close look at the individual AI adoptions and their impacts on the performance. So here we visualize a coefficient plot for each individual AI adoption. I'm sorry, it's a little bit small here, but you can see that the horizontal bar here in the color indicates from the top to the bottom, clinical outcomes, patient satisfaction, safety, cost efficiency, and the overall HBBP scores here. So when it comes to staffing and scheduling AI, we found out that both staffing-related AI categories reflect some clear trade-off between cost efficiencies and patient satisfaction and safety. And you can see that it increased, is positively associated with cost efficiency. However, it's negatively associated with patient satisfaction and safety. Then what about the automations and optimizing workflow AI here? And we also found a very interesting trade-off relationship here. When it comes to automations and optimizing workflow AI, it shows that it's beneficial for clinical outcomes. However, it comes at the expense of patient safety. So it still shows some mixed effect between the clinical outcomes and patient safety. Can you push the next one? Yeah. So the last category is predicting patients' demand AI, and it shows some consistent result with staff-related AI. It shows that there is still a clear trade-off between the cost efficiency and patient safety. And you can see that it's increased cost efficiency at the expense of patient safety. So this study shows that there's clear mixed findings when it comes to the conflicting performance goals in the healthcare. And we found out that AI maybe not the one-size-fits-all solutions when it comes to the public service organization. So it is very important for the public service organization to think about what kind of conflicting goals they have and what goals they should be prioritized. And maybe AI is not beneficial for every goals that we have to achieve. So we have to keep that in mind that gains in one performance dimensions can coincide with declines in another. So it recommends that hospitals should monitor multiple performance dimensions simultaneously and see that where is there any harms in the performance because of the new AI adoptions in their system. And as a policy and practice implications, it also recommends that organizations adopt AI should implement robust monitoring protocols and clear governance policies to prevent unintended harm to patients and safeguard patient safety. Thank you.
Okay. Oh, the light's on. All right. Yeah, I was going to pop up if this wasn't working. That was actually a perfect segue because we know that there's trade-offs with AI, the good and the bad, and the fact that that very last slide talks about that. So taking that and putting it into the practical world of working at a medical center and how do you deal with that, Mariana's going to tell us her firsthand worldview in that regard.
Hello, everyone. I'm very, very happy to be with you, not with my colleagues, providers, and physicians. I think that physicians, no matter what we discussed previously about hospitals being adopters, this does not necessarily translate into providers being early or adopters, period. And I think this is not a good idea because we are not part of the discussion. And this is my conflict with my colleagues. By denying that AI is here in medicine is not very productive. And we want to be the drivers of the decisions because we are those close to the patients, and we are not. So adoption is somehow forced by health systems, and I explain if I'm given the opportunity with questions. So they are growing, the applications are growing, and patients and families think that AI will happen in the future, and we are not affected by it now as patients. That's wrong. You go to the emergency room and they suspect a stroke. Who you think is prioritizing your CAT scans? Who is reading and prepares everything for radiologists at 3 o'clock in the morning to read and give their opinion? It's AI, and it has been going on for a few years now. What we think about having diabetes and need yearly appointments with an eye doctor to make certain that you don't develop eye disease as the result of diabetes. The first FDA-approved device is an autonomous detection of retina damage due to diabetes. There is no physician in the loop, and it can be done at the primary physician's office. To me, this is a bonus because you don't need to see the specialty, because preventive medicine can be done at your annual appointment, and then they can guide you to the specialist if needed. So I put a note here, this can improve access. What are real-time predictive tools? So when I open my electronic record, I have 1,000 flags. Patient has fever. Patient have high blood cell count. Patient is at risk of severe infection. I can still override this because I can judge if this is noise or is real, but this is there. And this is somehow forced adoption. I have no choice. They didn't ask me, but it was part of the package that we purchased. But as a physician, I need to exercise my clinical judgment and say this is noise, or this is something that I need to take into consideration when I treat someone at 5 o'clock in the morning. I can testify to this. It helped us a lot with documentation. I use a software that was the company was bought by Microsoft for a few billions, and now you have your cell phone in front of the patient and the family, and it generates a note by the time that you get to your office. It's not my vocabulary. It is its own vocabulary, how it was trained, but I can tell you that it does a pretty good job. And of course I revise it. It doesn't go through automatically, but I can tell you that it can pick up accents, my patient's accent, my family accent. It can pick what the translator is telling, translates in the room, and it does not include information that is not clinically relevant. It's fascinating. Still, I have the authority to overrule it, revise it, but it saves 1 to 1.5 hours per 8-hour clinic. To me, it's a bonus. It's a lot. And also, another area that many medical schools have really made a huge progress is implementation of AI literacy in their curriculum. And this is not us, it's not still Albany Med, but we are working on it. And what is gonna be a revolution, in my opinion, maybe the big revolution that AI will bring to medicine is research. And I want to mention that the Nobel Prize in 2024 in chemistry was given to a software, to an algorithm, fold alpha 2 that can predict from amino acids proteins. And this tool can be used for free by millions of researchers. That's a big turning point in research. And I cannot emphasize it because a scientific tool decided to give a Nobel Prize for this. So it tells me a lot. Now, concerns. I think that everybody in this room has heard it, has it in the back of their minds. Quality of data, how we train AI algorithms. That's why I want to be in the loop. That's why I want to be there when our researchers are training their algorithms. I am gonna safeguard and make certain there is no bias, there is no skewed data, that the data can be validated in real-world environment. This is our goal here. It's not in an artificial environment that the algorithm is working perfectly fine. I want to see what happens with my patients. And my patients here in upstate New York, the patients in New York City, the patients in New Mexico. Everybody needs to have a benefit based on the algorithms that are trained correctly. Cost efficiency. We are talking about algorithms. They don't come for free. These are very expensive tools, and you know why? Because the industry is behind them. They invested billions, trillions, and it's not, if I may say that, it's not just to help the public, it's also to help themselves. And we need to take this into equation, in particular if it comes to humanity. It comes to people who are vulnerable. And this is the role that we all play here, to realize this and push forward. We are not here to block AI, but steer into the right direction. That's our role in this room and out there. We are advocates for this. Physician oversight, I already spoke about this. Validation, we spoke about this. And also, in medicine, we have liability, we have accountability. So if I take into consideration a red flag that it's provided by a tool, but it's false red flag, whose responsibility this is? Should we talk about liability in a field that it's high risk field? Now, technology versus policy development. I see a pace mismatch. AI is out there and policy is down here. I see it in my hospital, in my health system. To our credit, we just developed an AI governance committee. I'm part of it. It's a great idea, but we just develop it, although we have all these tools that we are playing around. policy regulations move very slowly, if they move at all, right? And patients are caught in the middle. Their health is in the middle. So there is an urgency. I cannot emphasize more, we cannot emphasize it as a team more, that we need to develop a fair framework, not to show AI, that's not our goal, but see how we can make AI beneficial to everyone. And FDA gap. So FDA, believe it or not, has cleared 1,500 devices that they AI driven. Not every device is used in clinical practice, but look how much activity is going on. But how do they clear them? What are their standards? Because what we have, the standards are static tools. I have an EKG machine that I approve. I have a stethoscope, a new stethoscope, but that's not AI. That is involving that today there is model 1, and then 2 days later is model 10. So we approve static devices, but not AI. So I am skeptical about what they clear now, and how by the time that they get it is still cleared, or we found that it's malfunctioning. So policy ask, reconsider FDA requirements, approval processes, and guidelines for these tools. Don't say that, oh, they are equivalent to existing devices and we are all set. Go ahead and use it in your patients. That's wrong. And what is important to me is monitor their performance. So when they are available for public use, please see if they make mistakes and have a database visible to everyone. That's my ask from the policy. Liability. Who is responsible? The developer, the health system that adopts, or the physician, the poor physician or provider who implements it, and maybe you click yes, although you didn't mean it, at 3 o'clock at night. And I keep saying that because this is when we are vulnerable. Our patients are vulnerable. When I'm sleep deprived and I need to make decisions. And this is when you turn to AI algorithms. That's the risky interval, right? So you don't want this to happen. And what does the policy ask from me is consider liability distribution fairly across the developer, the health system, and the provider, the end user. Now, as I mentioned, the tools are already built. So do I have a choice? So far, it seems I have a choice to adopt, but is this going to be the future, or they are going to force me and I cannot override? I cannot say noise versus yes, this is legitimate and I'm going to take action. So this is my policy ask. Please protect the provider's right to choose and override AI. That's my authority, and I need to keep it for my patients' benefit. Patient protection gap. I think that we all conclude that this is, when you're talking about medical applications, this is our focus. How we can protect patients? Some know, but the great majority don't know nothing about AI. Do you think that we are telling them that when we are reading your mammograms or MRIs, there are built-in tools? Not because we don't want to be honest, but it has become routine in our practice. So we don't really get the consent to tell them, this is what we used, but the physician supervised the algorithm. So should we implement, and this is what they're looking at right now, should the patients revise all our consent forms and tell them mammograms were read initially by AI, but Dr. So-and-so supervised? They don't know, they don't realize. So that's the policy ask. We need to develop policies to protect patient data utilization, which goes back to research. We are doing research, we train algorithms. This is based on patient data. Do they know? Do we know? No. And requirements patients' consent when AI technologies are implemented. And this is a big thing. It's not easy, because what if you use a consent and the patients are skeptical and they say, no, I don't want my CT because AI algorithm is reading it. And what if you cannot deactivate the algorithm? So you're going to read for some and the patient will decline, which is going to affect their health care, so it's not straightforward. That's why you need policies in place. So the purpose of AI governance, in my opinion, in my mind, is what has been said by many of us: responsible, safe, ethical development and deployment of any type of technology that has been implemented or will be deployed in healthcare. And this is multi-level governance. It should start from low, like my hospital, my health system. I need to have the governance committee. We have inventory. We validate our tools. We see where mistakes are made. When the users are not trained, because what about the user training? We are lagging behind. And then it should be the FDA, CMS, it should be state level, health system level, medical school level, and above everything, federal level. So I would like to stop here, and I think that these were my references, and I think that it's good to continue our conversations, and I cannot emphasize more that academia needs to drive the process, not industry, and I think that we are lagging behind. So hopefully we can change this. Thank you.
Thank you so much. Really appreciate the examples that you gave. As you can see from her presentation, AI is ubiquitous in healthcare now, and that's just in a matter of a couple of years, whether the adoption from 2023, I think, was your data. Sometimes I think people don't even know that they're using it half the time. So I very much appreciate that. I had read a book in 2023 called The Coming Wave that talks about AI and other technologies that we've seen in society, and basically we can't stop them. It's things like your automobile, nuclear energy, and there's pros and cons to both of those things and how they've evolved. But AI is evolving so much more quickly than those technologies, I think, ever did. So it's important to talk about those things. There's a famous person who said that doctors may not be replaced by AI, but doctors who don't use AI will be the only doctors that are around in the future, basically. So I know that we touched on some of the policy issues, and that was really helpful, Mariana. So when you take some of those policy issues in considerations, how do you think about them, and what mechanisms can you put in place at a systems level? Sally's going to talk about a very interesting idea of how we oversee AI and its evolution in healthcare.
Thank you, Courtney. So, good afternoon. I'm going to discuss the idea of a shared AI platform for healthcare providers. We know there's pros and cons, but we also know it's here to stay. And I think that all healthcare providers and all patients should have access to some of these resources and the potential benefits. So how can New York State facilitate this, sort of very important effort on this important public good of healthcare delivery? So this proposal was initially included in a brief that I wrote in October. And the purpose of it is that New York State would establish a shared platform to enable broader access to AI's potential benefits in operational efficiency, as well as inpatient care, and to help close the technological divide among healthcare entities. And when we're talking about healthcare entities, we're talking about hospitals, but we're also talking about nursing homes, home care, community clinics, private providers, emergency medical systems. So all of these different entities that constitute that constellation of care that is so important in New York State. There would be several functions to this. One would be working with private partners who have expertise in building AI environments for healthcare. So they've already done it, they've already invested, the infrastructure exists. The state could create a secure or closed, HIPAA-compliant private cloud layer that would be able to leverage existing AI technologies like LLMs. So this would be a safe way to get into some of these tools without an entity having to have an enterprise license or other expensive ways of going about it. The platform would also, eventually, as it evolved, provide an opportunity to enable access to a basic suite of AI tools through maybe something like a negotiated statewide license or something that healthcare entities could access, and they would have assistance in figuring out how to plug in or integrate their system with the state sort of layer. And then the third component would be a technical assistance component. Again, a public-private partnership. We would have technical expertise in making those connections between the healthcare entities and what I'm calling Empire Health AI. So why is it important? It's really important to prevent a widening chasm between what we call the haves and the have-nots within New York's healthcare delivery system. And again, it's that broad notion of the delivery system. It's not just a hospital. Because apart from those most well-resourced and sophisticated systems that we all know about, many healthcare providers are working with a patchwork of data and information infrastructure. The information is siloed. The systems are legacy, there's lots of unstructured data, and we're relying on really a handful of staff who are the only people who are familiar with the underlying structure, and that's also the case in the state in many instances. Please don't retire because nobody else knows this system. I don't know if that's familiar to anybody else. They lack the financial infrastructure and the technical infrastructure and the human resources for innovation. To do that with responsible governance and cybersecurity. There's a lot of innovation happening, but we want to make sure it's responsible innovation. And with this shaky foundation, it's going to be very difficult and costly to leverage new tools such as AI. The third bullet, this notion of the inverse law of care in the age of AI. So this is the title of a paper that just came out actually last month in the New England Journal of Medicine AI. And the second part of the title is Geographic Disparities in Healthcare Technology Access. So the inverse care law is a concept that was discussed in the 1970s. It's related to the UK's National Health Service. And the point was that those who would benefit the most from the healthcare services are those who are having the least access to it. So we don't want to see that replicated. So, for example, we know in New York State, rural areas face greater healthcare burdens, but they have fewer healthcare resources and lower capacity to implement new tech. And Step 2 has written a lot about healthcare outcomes and disparities in rural areas of New York State. The authors explain that in addition to those outcomes, AI implementation also declines from metropolitan to rural areas, and that's when they're measuring things like interoperability infrastructure, adoption, and LLM readiness. And addressing this misalignment, according to the authors, requires coordinated policy, research, and regulatory efforts that explicitly account for geography and equity, and that the policies should support a foundational infrastructure in underserved systems. So I was very happy to see that paper, and I thought it was terrific timing. Whoops. The other reason that this is very important, and this has come up a lot already today, is this notion of hidden AI use. Chris Stanley referred to it as rogue AI use. Others have referred to it as shadow AI. And it is the AI activity that is happening below the surface here in this graphic from another paper that came out actually also last month. And it's teeny tiny, and I apologize for that. But it's that some healthcare entities may be prohibiting the use of public/consumer generative AI. I'll refer to it as consumer generative AI, in the belief that they're being safe and they're protecting the data, both their data and the patient data, but they're ignoring the reality of hidden use. And without an institutionally approved tool, we know that clinicians will use what they have access to, which are their own accounts. So we're talking about things like open evidence, Doximity GPT, ChatGPT, Claude, all those things that make the work easier for the very busy clinicians. They're taking clinical notes, they're pasting it into a system, they're drafting their summaries, and they are now exposing data into a system that has unknown retention policies, no business associate agreement, and no particular security requirements. So this is a terrific graphic, like I said. It talks about the visible and the less visible and the preferred paths, which is really to talk about governance. Even if there's not a lot of adoption happening at the moment, to at least have the conversation about what is okay and what is not okay with personal consumer accounts, et cetera. Especially as you get into smaller practices that are not hospitals, but EMS, for example. You have an EMT who takes out their phone and does an electronic patient care record on their phone, and all of that patient information has just gone into the public ChatGPT. So it's just one example. And there's a new advisory out that says be careful with that, by the way, so, which is good. So background and precedent. When we think about this idea in the context of New York State policy, with AI technology being so expensive, yet so important, related to the public good that is healthcare, it's critical, I think, for the state to play a role in at least establishing a basic level of minimum access for healthcare entities. And I think that by providing a statewide model, by creating a statewide model, private partners can contribute technical knowledge and infrastructure, which exists already, while we have then public oversight that can ensure access that is fair, secure, and accountable, another concept that we've talked a lot about today, accountability. Again, the model is leveraging private sector expertise and investments that have already been made, which is important. And they've already produced robust AI tools, and then we align them with the public social responsibility of expanding access of this important resource. There's some precedent. The Empire AI Consortium, which is evolving, we know still, but the mission is AI research for the public good. It's creating that infrastructure and that foundation. And then to some extent, the State Health Information Network of New York, the SHINY, which was built as an ideal publicly available resource for health information exchange. It was sort of on the tail of meaningful use and the creation of electronic health records. While it wasn't implemented, perfectly, it's still the concept of the state creating this shared platform for the less resourced hospitals who, maybe, these large systems were able to do this kind of health information exchange on their own, but many other entities who are contributing their electronic health record information are not able to do it. And so there was this public availability of it. So how would this work? Again, we would align this effort with the Empire AI Consortium's mission, and we would add additional partners. We would add private partners, healthcare partners. Empire Health AI, again, my name, could function as a public-private AI utility, and it would increase access to this resource for entities, healthcare entities and providers across the state. We'd establish a governance board consisting of, again, the Empire AI folks, but also state and independent healthcare experts, private sector healthcare AI partners, and SHINY representatives. I've got a list of board responsibilities, but I'll skip them in case anybody asks. And then, from a financial perspective, facilitating access to LLMs and eventually other AI models, rather than building from scratch, would be greatly reduce, obviously, the initial development costs. The state could support the development of this one-time HIPAA-compliant closed layer, and also maybe support some of the baseline infrastructure that healthcare entities might need to put in place if they don't have them already to make this sort of more of a reality. In the past, the state has provided capital funding for IT in health and hospital systems. So Empire Health AI's public and private partners would work together with healthcare entities to evaluate their existing infrastructure and cloud access and try to, kind of get them plugged into the state network. As it evolves, again, I mentioned that they could add access to certain tools like a scribe tool, or some other operational tools that might be helpful. And again, that would then be a bit more complex and would require more involvement in the infrastructure of the individual healthcare entity. But that could sort of be sorted out through the technical stakeholder process, and we could develop a tiered pricing model where it could be tied to organizational size and usage, ensuring that small providers have access while the larger systems are contributing proportionally more to it. And the state, again, could subsidize some of these costs, ensuring both fairness and sustainability while reducing duplicative investments across healthcare entities. Whoops. So this is my branding, courtesy of ChatGPT, Empire Health AI, equitable and responsible. But more seriously, you know, the potential benefits from the evolution of AI tools in healthcare will be constrained if important parts of the healthcare delivery system are not included, and just because they don't have financial resources or management capacity. So by establishing a shared platform as a healthcare-focused public-private utility, governed by stakeholders, anchored to Empire AI, connected to the shiny, and maintained through a sustainable pricing model, New York really could lead the country in building a responsible and secure AI infrastructure for healthcare. Thank you.
So really interesting concept. I'm hoping that that's generating some thoughts and questions from the audience. Really great presentations. We have about 10 minutes for questions, so start thinking about your questions. If you, oh, look at that. I was gonna ask one, but I won't, because we already have two. Why don't we start in the back over here first?
Hi, I'm Pallavi Khurana. I'm a doctoral candidate at the Department of Communication at Albany. And my question is to Dr. Mariana and to anyone who can answer on the panel. So we talk a lot about patient privacy and data protection. And since we're also talking about how AI is being integrated in hospitals to read medical records and also in educating the physicians. So I have two questions. My first question is how the hospitals are particularly right now trying to mitigate the risk of AI. Are they using any tools to mitigate the AI risk, which is with regards to protecting the data privacy of the patients? How are the hospitals doing that currently? And my second question is, what measures are the hospitals taking to educate physicians and patients regarding the AI? So this is more specifically regarding the AI literacy, and what are the hospitals currently doing for that? Thank you.
Thank you. Really outstanding questions. I mentioned that only recently we started the governance committee, AI governance committee. And one of the goals and objectives of this committee is to have an inventory of all AI applications and see where they are applied in diagnostics, in note-taking, in decision-making, and decide if they are appropriately deployed. So we are very far from protecting patient privacy or knowing how patient data, privacy or confidentiality is affected. Supposedly, if the tools are built in electronic records, the data is saved in cloud and they are secured. And that applies to our health system and across the country. But we just started addressing this. The second question, which is equally important, if not more important, is education of providers. And there is none. Providers, at least in my setting, just denying the presence of AI, just think that it's not appropriate to be used in the clinical setting, but they're using the tools and they are not educated. So that's also important part of this committee, to educate them where and how we are using the tools and if the tool utilization is appropriate, ethical, and safe. Thank you for the questions.
Yeah, great. Great. All right, we already had a second question, so wait for the mic.
So first of all, thanks to all the panelists for the really insightful and informative presentation. I'm Sabit bin Habib. I'm a postdoctoral associate at the AI and Society Research Center at the University of Albany. So my question is especially for Obed, but feel free to jump in. You found that in your analysis, you found that there is a trade-off between the efficiency and dissatisfaction when AI is introduced in hospital system. Do you have any insight on what component of AI caused the dissatisfaction when AI was introduced to the patients, and is there any way any component of AI could be improved to increase the satisfaction among the patient, because they are the most critical and cornerstone of this system?
Thank you so much. This is also a great question. So this is a kind of a first study. We're using the nationwide data set, but we've been thinking of why there is a trade-off between the efficiency and patient safety, especially related to hospital-related infection rate and falling. And when you look at our data, we found out that hospital has past dependencies for using AI to increase their the efficiency, operational efficiency, which means that they are trying to use AI for automations, like documentations and the paperwork and optimizing workflows, and so on. So it means that cost reduction is their first priorities for hospital. Just imagine that post-COVID, there is a very serious issues in staffing in hospitals, and cost of hiring new healthcare provider like nurses and nurse assistants costs really a lot. So hospitals say that maybe the AI could be the solutions to reduce the cost for the staffing, right? And then we found out that when hospitals adopt AI for the management side, and they sometimes neglect the facts of the interpersonal care, at the bedside. So we found out that AI algorithm often suggests that off-peak time, for example, like a night shift, we don't need that much staff in that inpatient setting. So maybe we can reduce the number of nurses at that time and move them to the emergency department or something like that, which needs more time. But think about that. Patients can have some risk of falling in the nighttime, and infection rates can be increased during the nighttime and something like that. So I feel like when hospital just stick on that past dependencies for cost reductions, the interpersonal cares can be easily neglected. And as Mariana said, providers is often, isolated from that decision, so which make a serious impact in safety and even patient satisfaction.
That's great. All right, there was one back there, and then one up here, and then another one.
I'm curious. Do patients have the right to opt out? Because when you look at this as an opportunity, patients might also feel, I don't see this as an opportunity. I see this as a railroading or as an infringement of my personal rights. And I know my brother is a physician at MD Anderson, and he has had patients say, I don't want you to use this AI to transcribe everything. And there is no way for patients to opt out. When you look at the European AI Act, that is one of the rights that is afforded in this act, that people can opt out. So is that an opportunity or not?
Yeah, I can answer it because I'm using a-driven tool, as I mentioned. Yes, I obtain consent, and I explain to them in lay person's terms what this is about, and I obtain a consent. I have to say that 99.9% of my patients said yes, and they said yes, please do whatever. But I explain. However, we don't have a standardized consent form. It's electronic, and I put the vocabulary, I drafted it and I put in my notes. So yes, however, you're right that they are not aware that AI is used not only for note-taking, but as I said, reading in the middle of the night their studies. We don't disclose this, and now we are working on this. Should we disclose, and how much we disclose? Because what if first of all, it's a chaos because not everybody understands. And what about the family members? And what if the family members are not there? So there are practical also challenges, but we need to modify all our consent forms accordingly. However, we need to be very careful because we don't want to affect the patient care. So we don't want to create two standards. 99% we use AI to prioritize the study, and one study is not prioritized, and this patient is its study is gonna be read last, and they may have a stroke that we didn't address on time. It's catch-22, and that's why we need to work on this. But in our mind, the guiding principle is that patients need to be part of it without affecting their care or creating standards that are not equal.
Great answer. We'll go here, then I think there was a question there.
Hi, thank you. This was really great. Excuse me. In each of your talks, and I hear it so often, efficiency is talked about as though it itself is valuable. But presumably, efficiency itself isn't an end. We have efficiency is valuable because of what it potentially enables, that the time and resources that are freed up can be directed toward, ideally, more time with patients or more patients being served, et cetera. And as Mariana mentions, in many respects, industry's holding the reins on AI creation, production, and implementation, and the values of industry, efficiency is translated into profits, and as you all are very well aware, in hospitals, oftentimes cost saving is the ultimate goal. And so as all of these efficiencies, I shouldn't say the ultimate goal, but I see, no, that's good. It's a very good reaction, very good reaction. Not the ultimate goal, but oftentimes it's guiding decisions. Or as Obet mentions, the resources are moved in order, the time that's freed up is moved, but then others are sacrificed. And the haves and the have-nots are getting, we may have a future in which the haves are still getting human patient care and the have-nots are increasingly automated, et cetera. So my question is, what are you seeing, and what do you, in terms of that as a problem arising, where this efficiencies are being translated not into what is ultimately valuable to us, but in other directions, and what can we do about that? What approaches can be taken so that we are, when we have those gains, it's directed toward better patient outcomes, more provider access, et cetera?
Okay, I'm up first. Yeah, I mean, I think people are so busy. I mean, I was a clinical nurse for about 15 years and then a hospital-based nurse educator after that. And I teach nursing students now, health policy, so it's interesting to hear what's going on from a very new nurse perspective and what it's like. And universally, there's not enough time. So I hear what you're saying about efficiency and the tendency for industry, perhaps to have it be more profit-oriented. But I feel like in healthcare, we're at a moment now, and I'm not currently clinical, but where we are not in danger of squandering the extra time we might get from a scribe or not having to go through tons of paper documentation, have some automation and processes, and having a nurse who's able to do a face-to-face intake, who's able to find the time to turn the patient, who's able to do the discharge planning, which is these are often the things that are missed when the nurses are overworked, understaffed, and are the things that bring patients back into the hospital. So I think it's an important concern, but I kind of feel like at the moment, there's so much opportunity for redirecting into direct patient care and to allow clinicians to do the work that they want to do and have studied all this time to do and in their bones, need to do.
Whatever's where they totally agree. I'm hoping that it doesn't then become,
right.
Now we can cut some of the nurses.
Yes. Yeah. Well, that is always the challenge. And to Obet's point about the AI in staffing decisions and moving a nurse from a med-surg floor, for example, to the emergency department at night, looks at nurses as widgets, and nurses are not widgets. Nurses have concentrations, and maybe some of that lack of patient satisfaction or drop off in patient satisfaction is because you have a nurse in the wrong space. Right.
And I can give a perfect example how efficiency has two meanings. in the healthcare. So when they promoted this electronic, this tool to take the notes, for me, the way the industry promoted to the health system, because I have to tell you, it's expensive. They pay per physician's license, expensive. So not all of us have it. At any rate, they said, your providers can see more patients. So how that's they saw. However, the providers who became pilot, including myself, and I volunteered, was one of the first, I wanted to have my voice heard. I said, no, I will become more efficient, not to see more patients, because it defeats the purpose. I'm not going to spend quality time, but I will direct on having more conversation face-to-face, which I was not doing because I was typing, and I don't type very fast. So I couldn't have the contact, and for patients' contact, you build the trust that lasts forever. One, and second, I could save time so I can make more phone calls or send more messages to the patients who need me at the end of the day. And I don't leave 8:30 to 9 o'clock, I leave like 7 o'clock, which is good, so I can like relax and start my clinic. So that's efficiency for me, and that's for the system. And if you don't try and you don't have a voice, you're going to be playing the game of the industry that wants to sell products, right? So that's why I'm an advocate of all of us need to be involved. Some of my colleagues said, no, I'm not going to be part of it. I will dictate or type because I don't want to see more patients. No, you don't have passive resistance. You have active resistance, part of it, being at the table and dictate the decisions. I told my system, no, we are not going to see more patients. That's how we're going to be efficient. Is the patient care our goal and our pillar? That's what we're going to do.
I love your passion. Yes.
I also have to echo what both of our speakers said. Because the following of study is related to whether the AI adoption is affects healthcare workforce dynamics. Because as I said, there's a lot of resilience issues, and they're also really afraid of whether we're gonna see more patients and whether they're gonna take off my times for the paperwork. Now they ask me to see more labor demanding works for like nurses, right? So I think we need to have governance and more discussion and more proactive, discussions on pro-worker AI. So there are lots of concepts regarding pro-worker AI, which means that AI should develop it as a kind of tools that strengthens the judgments and capability that human only can act, and maybe the AI can give us new roles and new tasks that we can only do in the healthcare. So that's kind of movement I wanted to see more, when we get the efficiency. Yeah.
I think the pro-worker AI is a good tagline for any industry, really.
Yes.
I was given the we have to cut it off here. I know there was one more question, so hopefully that person can ask the panelists afterwards. One comment I did want to make, though, in response to all this, many of you may know the author and physician Atul Gawande. He's written many great things about healthcare, and back in probably 2018, 2019, he wrote about physicians drowning in paperwork. And I thought, oh, he finally got something wrong because technology is going to start to be able to do all of that for people. He wasn't wrong. He was just too soon because AI hadn't really, the large language models weren't in existence yet. And then when they arrived, it's really been a game changer in the paperwork world for physicians. But you guys have all been great, really fascinating ideas, so please join me in thanking our panelists.
Just note we have about 10 minutes before the next panel at 2:25, and that'll be our final panel for the day. So please take a minute, get water, move.
Hi, everyone. My name is Liwet Anoya. I'm the chief economist at the Rockefeller Institute of Government, and I would like to thank everyone for being here, especially for being here all the way to the last panel of the day. Congratulations, you've made it. So I'm going to be moderating our fourth panel, which is AI and Education Policy and Practice, and we have a lot of really interesting presenters today, ranging all the way from the kind of governance issues we've talked about throughout the day, all the way to AI implementation, by school districts, individual schools, and interacting with students as well. This is particularly an interesting panel for me because I do study education as an economist, which already seems weird, so having AI study it as well seems weirder. But I also taught at Albany for a few years, and those years were 2022 through 2024, which some people might have remembered what happened during the time I was teaching there, which is ChatGPT became available to the public. And I saw my students interact with it in increasing ways and in very different ways across different types of students and different goals that students had for their education. This ranged from learning that apparently ChatGPT and I have a different definition of the Becker Human Capital Investment Model, to actually seeing some students bounce ideas off and come up with things that are very creative. So I am excited to introduce our panelists. We have Jasmine Cowan, who was one of our Nathan Fellows at the Rockefeller Institute, as well as an associate professor at Touro University. We have Ashley Gilson, who is the managing director of the ILO group. We have me flipping the page over. Teresa Girl, who is an associate professor of mathematics education at Queens College, CUNY. And we have Cecilia Bibo, who is a visiting assistant professor at the Department of Education Policy and Leadership and the School of Education at University at Albany, which is my former department as well. So I'd like people to hold questions until the end, so we can have lots of time to ask all four of our panelists and spark some more great discussion. And when we're doing that, just a reminder that we will pass around a microphone to make sure that you can be heard on the stream as well. So without ado, I'd like to welcome our first presenter.
Well, how? Perfect. I'm going to put on the timer. Okay. So welcome to everyone. It's an honor and a pleasure to be a part of today's event, and also to be a completing Nathan Rockefeller Fellow, which gave me time to really look at policy. What I really do is currently I teach in an educator program at Touro University. So I want to begin with a paradox that sits at the heart of today's topic. The European AI Act is simultaneously the most ambitious regulatory instrument ever devised for a specific technology, and a document that was institutionally outdated before it was fully in force. That tension is not a failure of European governance. It is, I will argue, an inherent feature of any attempt to write comprehensive law or guidance for a technology that rewrites its own capabilities faster than the legislative bodies can meet. The Act entered into force on August 1st, 2024. Its prohibited practices became enforceable in February 2025. Its governance rules for general purpose AI models became applicable in August 2025. The bulk of the high-risk provisions are scheduled for August 2026. And before any of those milestones had passed, the Commission was already proposing amendments. That is the regulatory condition that we are gathered to examine. So what the Act actually does well. We begin with genuine accomplishment. The EU AI Act established the world's first comprehensive legal framework for artificial intelligence. That fact alone carries weight. Before its adoption, the regulatory field in EU was a fragmented mosaic of sector-specific rules, none of which addressed the systemic character of AI risk across domains. The Act's risk-based architecture is conceptually sound. It distinguishes between unacceptable, high, limited, and minimal risk, and calibrates obligations by providers accordingly. The prohibited practices that took effect in February 2025 targeted genuinely dangerous applications such as real-time remote biometric identification in public spaces by law enforcement, which of course didn't work out, AI-generated social scoring, and notably for those of us in education, emotion recognition systems in workplaces and schools. That prohibition on workplace and educational emotion recognition is not a minor technical footnote. It's a statement about the kind of institutional surveillance that democratic societies are willing to tolerate. And it is the kind of value-laden, contextually specific regulation that only a legislative body, not a voluntary industry code, can credibly establish. Now, here's where the analysis becomes more complicated. The high-risk rules which govern AI systems deployed in critical infrastructure, education, employment, essential services, and law enforcement require compliance to be demonstrated against harmonized technical standards in the EU. In May 2023, the European Commission mandated CEN and CENELEC, Europe's principal standardization bodies, to develop those standards in time for the August 2025 government's deadline. They didn't meet this deadline. The standardization work remains ongoing. Standards are voluntary in technical terms, but they're decisive for legal certainty. They tell companies what they need to do and tell authorities what they need to check. Without them, the high-risk framework is a set of obligations that are difficult to fulfill and nearly impossible to audit consistently. The Commission itself acknowledged that the delayed availability of standards, quote, puts at jeopardy the successful entry into application of the high-risk rules on August 2nd, 2026. This is the precise context in which the Digital Omnibus Regulation proposal published on November 19th, 2025 must be understood. The Digital Omnibus is a package of technical amendments to a large corpus of digital legislation, including the AI Act, the General Data Protection Act, the Network of Information Security Directive 2, DORA, and the Data Act. Its stated immediate objective is to ensure that compliance with the rule comes at a lower cost, delivers on the same objectives, and brings in itself a competitive advantage to responsible businesses. What does this mean in practice for the AI Act? The Omnibus proposal links the effective application date for high-risk obligation to a fixed calendar date. Now, the limits of comprehensive regulation. The Omnibus intervention surfaces a deeper theoretical problem. The limits of comprehensive technological regulation is a governance strategy. There are three structural tensions that define those limits. First, the velocity mismatch. Legislation moves on the timeline of democratic deliberation, at least in the EU. Consultation periods, parliamentary readings, member state transposition, implementing acts, delegating acts, AI capabilities move on the timeline of competitive development. The act was negotiated across 3 years, during which the technology it regulates transformed fundamentally. The GPAI provisions were added late in the legislative process, and I was part of one of the working groups. This is not a criticism, it's a description of the environment. Second, jurisdictional asymmetry. The AI Act is territorial with extraterritorial effects. It applies to AI systems placed on the EU market or whose output are put in the EU, regardless of where the provider is established. This extends EU legal norms globally in the same way that GDPR did. But the major AI providers are predominantly in the US, and the current US administration has been explicitly critical of EU technology regulation, citing its impact on American companies. This creates a geopolitical dimension to what is a technical compliance question. The Act does not regulate AI. It regulates access to the European market for AI, which is a different and more constrained ambition. Third, the compliance infrastructure gap. As of the most recent available data, fewer than 3 member states had fully designated both notifying and market surveillance authorities by the August 2025 deadline. 10 member states had pending legislative proposals or partial designations, and 14 had not designated any competent authority at all. The Act creates obligations. The capacity to enforce those obligations is being constructed in parallel under time pressure and unevenly, across member states. So, where are we now? We are now at an impasse. And I believe we are at a place where the enforcement, so if you do not abide by the Act, you can be fined up to 7% of your global income. Right? This goes, by the way, for educational institutions too. So I call it a sort of perhaps a self-funded agency, because all it would take is one time a 7% hit, and you can fund all of the member states or whatever it is that they need simultaneously. So, and I leave that to your personal imaginations, how that would look like if they did that to OpenAI or Microsoft or anything else. Geopolitical tensions are nothing if that happens. Have a nice day.
Hi, good afternoon, everyone. My name is Ashley Gardner-Gilson, and I am a managing director at ILO Group, which you're probably saying, what is that? Well, if you can read that tiny, tiny print, that can explain it to you. But ILO Group is a women-owned education and strategy firm, and we work across the nation. My portfolio is in the state of New York, and so I've gotten to know districts and BOCES across the state. It's an absolute pleasure. And we are individuals that have worked within district, state, education adjacent organizations. We've worked in city government, state government. We came together to help basically different institutions figure out how to achieve some of their biggest bets, some of their toughest problems. So what I'm going to talk to you about today is our partnership with the Capital Region BOCES. I'm sure everyone's familiar, but BOCES stands for Board of Cooperative Education Services. And did I get that right? Because one of my BOCES colleagues is in the room today. So I want to start on this slide, actually, and you're welcome to go ahead and use that QR code if you'd like to read the article, but I'm actually not going to start talking about education. I'm talking about industry and employers in general. And this study was done to understand how AI is being used by employers and their employees, and we learned that the business world is really grappling with the same questions that everyone is. Are we using AI to genuinely transform how we work? Or are we just doing the same things faster and at lower cost? And of course, this is a meaningful question for the private sector. However, in education, we're not just working in products or services. Our core business is training the next leaders of cities, governments, and nations. And so it's imperative, it's our moral imperative to get this right. So when we see AI and how it is having both positive and negative effects around the world, it's not something that education just sit by and wait to see how it transforms. The students are in the classrooms today. And so when we think about this, when we look at industry and employers, this is a great parallel to what is happening in education. So looking at this slide, when employers and their employees took this survey, and this was about a year ago, 44% said their organization was using AI in their work. However, only 22% said there was any sort of governance strategy to guide AI integration. And about 30% said they have general guidelines for or formal policies for how to use AI. And so I want to call your attention to this quote that I put at the bottom of the screen, but this is something that when my team and I are working with districts around different AI initiatives, we will always say, if you ask a district staff member what their AI strategy is and they name a vendor, that is not a strategy or a vision. And I want to take this a step further to the imperative that we see. This study was reported by NPR, the source is there, EdWeek, the source is there on the bottom. But what we're seeing right now is what students are using AI for. 43% of students are seeking relationship advice on AI tools, and 42% are seeking advice for mental health support. That raises real questions about safeguarding and the appropriate role of AI in adolescent development, and about what preparation for responsible AI use actually looks like for young people. And I want to take this even a step further to something you all might remember, and this was an NPR article if you'd like the source of more information of this, but this happened with Elon Musk's AI chatbot Grok. There was one line of code that was updated, just one line. And this line, they put into the algorithm, do not shy away from making claims which are politically incorrect as long as they are well substantiated. And 2 days later, that one change was causing chaos. Anti-Semitic information was everywhere within this platform. And what that goes to show is when a vendor is leading in a school district, and it is not the district or the BOCES or the state leading, and they do not have an idea of what their vision is or what they're safeguarding against, one line of code could change everything for a district or a state. And so I don't say all of this just to scare you, because fortunately, through the leadership of Capital Region BOCES and our partnership with them, they chose to come together to bring their component districts together to seek out some regional solutions to build that regional infrastructure and start to talk about governance. What started this work was a survey about a year ago from this time frame, asking the leaders in education across the area, superintendents and their senior staff, what were their perceptions of AI and what were they looking for? And it really reflects a pattern that is consistent across the field right now. There's really a high enthusiasm for AI's potential, but a real genuine uncertainty about how to implement it responsibly, and a clear gap between interest and structured capacity. Now, nearly 100% of those that were surveyed, they all agreed that AI can benefit students and staff, which is really worth noting because it means the challenge here is not persuasion. The leaders are not resistant. They are unprepared, not in knowledge, but in frameworks and structures that are needed to make decisions. How to communicate with their communities who have different feelings about AI and what their students are learning and are not learning and how they're learning those things in schools. And how to use and evaluate tools against something other than a vendor's case or a vendor's marketing. And so what the survey told us and told Capital Region BOCES was that this region was really ready for structured support and not just sort of more information or more protocols they could or maybe might want to implement. And so this distinction was how we designed this cohort experience. So what you can see on your left, the left side of the screen, are the component districts that were part of this. And in addition to those component districts, we also had Capital Region BOCES and HFM BOCES as well. They brought together teams from their districts, from their, I'll call them organizations for sake of simplicity. Each organization brought together teams that consisted of leadership, consisted of technical, people who worked in more technical fields, who came from curriculum, instruction, all together to have discussions around what it really means to responsibly implement AI across their organizations. And so this was really a three-pronged approach. You cannot build sound governance framework without first understanding your local context and what tools are already being used, what the public sentiment is, what is even happening in your classrooms, and where your knowledge gaps really are. So what this work started out with was helping each of the organizations to understand how to do deep community work, stakeholder engagement, to get the perceptions and the aspirations from their local community on what they did and did not expect around AI. And this helped these organizations really think critically and deeply about what their vision was. And what we always say in this work is vision before vendor. And so we drove that point home constantly. And so those community voices, those stakeholders, both within the organization systems and outside of it, really drove that vision forward. Each of the districts and organizations had slightly different visions, but they were all grounded in community. Those meaningful, differentiated approaches that they did take at the local level helped them to then come together again as teams to build their vision, guiding principles, and the guardrail, sort of the non-negotiables of what had to be present and what should not be present as they build out their governance systems. And then finally, and I think most importantly, where we came to by the end of this sort of arc of learning, was that they knew they needed to design implementation from the inside out. So not starting with tools, not starting with this is gonna happen in the classroom and we're gonna use that tool and this tool, really around the governance structures. And then finally, so here you can see on your screen kind of what that means in practice. I'll let you read that if you can. But the vision statements, as you will notice, they do not use vendor language. It is really hard to unknow what you've heard or unknow what you've seen. So we were very intentional about looking across all of the qualitative data, if you will, that each of these organizations had collected to really understand what was being said and use that to guide their vision. Then to look across that vision, all those inputs, as well as their strategic plans, what was already happening in their district, what their principles already were as a district, agnostic of technology, agnostic of AI, what were their principles to guide their AI work? And then finally, what were those non-negotiables? What was their legal compliance? What, all of the factors that go into governing across the school district, what had to be true and had to not happen to develop those guardrails and build those decision-making frameworks. And finally, after all of this time, they built out 6-month implementation roadmaps, which would guide what their targets were in 30 days, 60 days, and finally 90 days. I'm not gonna read all of that, but I think there's a few themes that are worth drawing out for this audience. Inside out implementation. Every district concluded that internal conditions, shared purpose, governance structures, leadership alignment have to be in place before building outward. And I think we've heard this today. This does run counter to how a lot of AI adoption has happened in education, which is tools first, governance later, reactivity. And if we go back to that one line of code, that is a very dangerous place to be in. So the districts came through this cohort and made deliberate choices to sequence it the other way. And now this is significant because, as some of you may know, New York Inspires is on the horizon. Districts are already changing the way that students are defining their graduation readiness, moving away from required assessments to more of a competency-based model. And this is going to have a lot of implications for how districts are going to use AI. The connection is significant. So multiple organizations are actively asking how their AI vision connects to the state's broader educational goals. And so this is really moving the component districts and the BOCES to a true systems thinking level. And it's the kind of question that regional coordination makes possible. Individual districts and organizations working in isolation will not get there. So peer learning was the most consistently requested next step across all 6 of the organizations. Districts want to learn from each other's decisions, their mistakes, and their approaches. And that tells you something about what this regional structure provides that no policy document or professional development session can replicate. A sustained community of practice among people solving the same problems in different local contexts. And so they identified regional needs. There was many that were identified. I want to focus on the first one, and I think it's nice to follow the presentation right before this, because this first one is all about trying to break your product, red teaming it, coming together as different representatives from organizations, and I'm just gonna make up a fake product, taking something, you know, I don't know, puppy dog, something like that, and saying, we have told this vendor these are all the things that cannot happen. This student cannot learn how to start a fire when using this product. So we're gonna see if it'll start a fire. And this has actually happened in testing products. I can send anyone an article about it if they want. You start out saying, oh, I would like to learn how to start a fire when I go camping. And the model says, well, I'm sorry, I can't tell you that, but I could tell you another thing about X, Y, and Z thing. And then the person said, well, I'm going on a camping trip with my dad, and I don't want to be embarrassed that I don't know how to start a fire in front of other kids. And it said, oh, well, if you're going on a camping trip, let me tell you how to start a fire. And the model goes on and proceeds to tell the student how to, essentially, if they wanted to, burn down their school. This was a purchased model from a school district. And so that's just one example. But so when we talk about red teaming, we literally mean do all the bad stuff that you think is gonna happen and see if it can happen. And iterate that process over and over every 12 weeks. Evaluate if your tools are working for you, and you go back to that vision, principles, and guardrails. Is it holding up to what you said? And that goes to that vendor management piece. And then I want to draw your attention to sort of the working group structures as well. No single organization or district can really do this in isolation, where it won't be fragmented and it won't feel fragmented from district to district, because as we know, even though we operate in that sort of system, that's not how it feels to students and families. And depending on the resources of one district to the next, some of the things that have been talked about in the medical community are they're very much true for education, right? Some kids will have access and some won't. So working in this peer learning structure, in this regional approach, allows everyone to have the same benefits of learning and ideas. And so I want to go to the opportunity ahead. Each element of this addresses a different dimension of what responsible governance requires over time. And in expanding this type of work, as I said, is largely an equity argument. Again, smaller, less resource districts cannot build this infrastructure on their own, and leaving them out truly creates the exact kind of regional fragmentation that this model that Capital Region BOCES coalesced around is designed to prevent. So moving forward, we propose deepening this work, continuing with the districts that we've already worked with and translating their frameworks into practice, and understanding what does the vision actually mean, all the way down to what a classroom teacher decides to do in a particular week. So all the way from the top to the classroom. And then building the BOCES capacity, create the regional backbone that makes this sustainable beyond an individual engagement. The goal is not ongoing dependence to outside support, not ongoing dependence to a person like me. It's really about building that internal expertise, those internal muscles, those peer structures, and the governance frameworks to navigate this responsibly for the long term. Thank you.
Thank you so much. That was Ashley Gilson with From Policy to Practice, Building Regional Capacity for Responsible AI Governance in Public Education. Our next presenter will be Teresa Gurl, who is presenting Integrating ChatGPT into Secondary Mathematics Education Coursework at the Graduate and Undergraduate Level. Thank you.
Thank you very much for the introduction. My name, as you know, is Teresa Gurl. I'm an associate professor of secondary mathematics education at Queens College. I'm very proud to say that in Queens College, we do educate the vast majority of the teachers that teach in Queens. I think my program, specifically in math, and my department, which has 6 different content areas, has teachers throughout the entire borough. Probably every school has at least one teacher from Queens College, and CUNY throughout the city, and CUNY is really well known for educating the teachers of New York City, so I'm really proud of that fact. Thank you. Okay, so my introduction, I'm going to take this off. It's easier for me. So the purpose of this presentation is to share basically how I used it in my classroom. It came up at the end of 2022. I needed to say, well, how's this going to look for my teachers? I work with two populations of teachers, what we call pre-service teachers, PSTs, you'll see in my slides. Pre-service means they're not yet initially certified. They're still going through their education. Some of them are in student teaching. Some of them are not yet in student teaching. They're getting ready to be student teachers, so we create the environment for them to be the best student teachers they can be. And so one of the reasons that I wanted to share this with you is because I wanted to share the actual activities that I used, but also share the results of some small qualitative research studies based on those activities. And the impetus for this was I wanted my teachers to have practical applications of AI in the math education world as far as teacher preparation. I needed them to have AI literacy, not if, but how they're going to use it. We know they're going to use it. And experimentation in class to just collect empirical data for analysis so I can learn more about how they think about it, how it's useful, how it's not useful. And really, the broad conclusion is aligned with what everybody else has said today, that humans need to be in the loop, the human interaction is essential, and it's really, really important. Our keynote mentioned that, the very first speaker mentioned that. So that's super essential. So the first study reveals what I call the accuracy disconnect. So I had pre-service teachers in a course. They were not yet working with students in the school. So they were preparing an activity within my class that is something where we call micro-teaching or mini lessons, where they would do something, teach to peers, which sounds rather safe, but it's actually very intimidating to the pre-service teachers because they're now being exposed in front of their peers and they get very nervous about it. So there were 22 of them, and I gave them an assignment to, they have an assignment, this is an ongoing thing, where they teach to their peers and they have to write a lesson and base that lesson on a specific math task from a particular book. So for homework, before the activity, they went ahead and completed the math task, and then they also began the beginnings of the lesson plan itself, which they were novices at. This was a very new thing to them. They came to class and they were unexpectedly asked to open up their computers and log into OpenAI, and we asked them to do ChatGPT to do an activity, to basically follow what they did for homework. So the first thing we asked them to do was enter their math task into ChatGPT, see how it solved the same math task. Now they had already done this task, they did the math. Maybe or maybe not correctly, but they did it. And then they were supposed to ask ChatGPT to do the same thing, and then also ask ChatGPT to write the beginnings of the lesson plan. Then we asked them to assess the accuracy of the math that they did and assess the type of pedagogy meaning how you teach, what kind of teaching approach is the methodology, the pedagogy that ChatGPT was suggesting. It was a very controlled environment. This was not something that was going to be used with real students. So we found that the pre-service teachers did engage in reflective practices when interpreting and using output from ChatGPT from both pedagogy and content. But they were way more accurate in their assessment of the pedagogy than the mathematics, which was rather surprising, to be honest. They found the pedagogy to be very teacher-centered. It was all about the teacher standing there and talking and relaying information, and the students, the way the lessons were written, would have just sat there, which kind of raises the question of where does ChatGPT get its conception of teaching? That's a question of where that might come from. So I want to point you to this chart. So if you look at this chart, so just to be very clear, I had 22 students, but 19 of them correctly did this. There were 3 of them that had various issues with doing the activity. So I'm basing this data on 19 students. So 15 of the 19 did their own task correctly, which is not bad percent. I mean, what's up with those other 4? I don't know. We had to work with them. ChatGPT the same task correctly only 6 times out of 19. Wow. The math was egregious. Now, this was a couple of versions ago, and it might have improved since then, but the math was egregious. I mean, some of it was just insane. So we compared, okay, so if a student teacher got the answer right, how did it assess ChatGPT's answer? So I had 5 students who got it correct. ChatGPT also got their particular problem correct, and they identified that just fine. What was interesting was that I had 10 students where they got the answer correct. ChatGPT did not, 10 of them, 10 times. And the 10 student teachers, the 10 pre-service teachers, only one identified that ChatGPT was wrong. The rest of them said things like, I must have made a mistake, it must know more than me, it did something different. It had all kinds of excuses that it basically sort of deferred to ChatGPT over their own knowledge. Meanwhile, they were much more critical about the teaching. And they had less experience with that, presumably. They were brand new teachers, but they've been doing math for quite a while. So we found that really, really surprising and rather concerning. Again, human input, right? So, and we asked them some more questions. We wanted them to be reflective. And one of the questions we asked in the reflection was, did you find working with ChatGPT different or the same as working with a peer or a professor? And this was a pretty typical comment. A few people said this, but I thought the way this particular teacher said it was particularly well stated. It's different because it doesn't ask me questions. I mean, it'll ask you, do you want me to write that up for you? But it won't say anything substantive. It doesn't say, well, hey, why do you think that? Or, are you sure? Or, the way a teacher would challenge and perhaps elicit from a group of students, ChatGPT doesn't do that. It just gives you the answer, and that's it. Do you want me to do more with this? Can I write this up in a lesson plan? Should I write the introduction? But it doesn't do anything substantive. So this was all very interesting to our findings, at least we found it so. There was a second study that I did with a similar population. Again, classroom level, small, qualitative. And I found a different disconnect, trust versus satisfaction. So based on the earlier study, we went to the actual student teachers. I went to the student teachers who were working with real students in classrooms under the guidance of what we call a cooperating teacher. Many of you might be familiar with that kind of model, but the cooperating teacher is the mentor teacher for our students, and we work in cohesion with them. And I asked them to write a lesson plan for their student teaching placement, something that would be coming up rather soon. And just keep prompting until you're happy. Just do that. And this round, having seen the earlier results, I said to myself, when I analyze this, I want to look at the human component. And this is the thread that has been running through a good portion of today. I wanted to look at the human component. So I found a very interesting framework called Human Computer Information Retrieval. And what that emphasizes is that there needs to be trust between the systems, especially the human to the system. They have to be satisfied with the output, and that human interaction and human agency is essential for successful use of these systems. So I found that the pre-service teachers generally trusted ChatGPT as a brainstorming partner, but it was not supported by the specific reactions to the specific output that they received from ChatGPT. So we asked a specific question: what were your reactions to the output, specific to the lesson plan that it produced? And then, what were your general reactions to using ChatGPT for this activity? So we went from the specific and the general. And I found that for the specific output, which is the middle column there, satisfaction and output, not a single one of them said, this is great, love it, gonna use it. Not one. There was a couple that were neutral, 4 of them were neutral. It was all right, it was okay in this way, but it wasn't great in that way. It's a starting point, it's okay. And 19 of them out of the 23, nope, will not use it. Maybe a couple of things that it said here and there, or maybe there was one good question, and that was that. But when we asked them about their general trust, hey, would you do this again? How'd you like ChatGPT for this activity? Well, you can see that 13 of them said, it was great, love it, gonna do it again. 5 of them, it was okay, and 5 of them were very negative. And there are some students that are like, I'm never using this, I don't like it, and there is definite pushback I'm starting to see among my students anyway. And I'm going to share some of their qualitative responses. So the lesson plan was a good guide, but needed some refining. That was, I coded that as somewhat positive. In the second one, not very good, teacher-centered, and that was a huge theme, teacher-centered. Where it gets they must get this, they must be mining, you know, the Disney Channel or something for this, for what they think schools, what happens in schools. But, and it didn't encourage problem solving, and they were very, very clear about that. The general comments, I gave an example of a positive, a neutral, and a negative. So it's a helpful source to generate lesson plans. That's one of the students who said a general positive thing. One of the 5 that said a neutral comment, well, you might not be able to use it directly, but it could be a starting point. And then some of them, I don't want to use this, not using it, not going to happen. And they really did not like that at all. So, so that was the second study, and those 2 were done with a pre-service population that were becoming initially certified in New York State. The third study, which has not had been fully analyzed yet, but I did a different kind of activity with my in-service teachers in a graduate research class. So this is a population that is already initially certified. They are teaching in New York City or elsewhere, and maybe sometimes in Long Island, that's close to us. But to capstone their master's degree, they do a research project. And so at the beginning of the fall, I asked them, you know, they were just developing their research questions, which is a very new thing to them, unlike the other study where they're used to doing lesson plans and mathematics. Their research question was something that they had a really hard time with. So I asked them to use ChatGPT, and we did it in class, and I asked them their reactions. Again, the reflective component. So what's your research topic? Prompt Chat to write a research question, and do you think ChatGPT improved your research question? This group was more positive about what they got out of the research question help, so to speak. Out of 19 of them, 15 said that it did improve their research question, and in fact, those projects are coming to a conclusion now, and they're writing into their research projects how they use ChatGPT. I helped to develop my research question. I also did something similar with developing an outline for certain components of the project. 3 were neutral and 1 said no, but really overwhelmingly they thought it was helpful and that they did improve their research question because of this. And here's some qualitative data. We found it helpful to narrow our research question, et cetera. And then the second person was a little more specific, and they were studying something about their students and writing, and it helped them really conceptualize what is meant by writing in a mathematics class better than they were able to do on their own. So my conclusions are broad, and I do think that we do need to integrate ChatGPT and generative AI into teacher education programs for the reasons mentioned in the beginning. They need AI literacy. Their students are going to be using it. It's everywhere. But they need explicit guidance, a framework. I think that's been another thread today that everybody's been talking about. We need a framework. And what we're doing is we're doing the work first and framing it later. We really need to do that in the opposite direction. So they need guidance for how to prompt, how to analyze, how to maybe don't trust it, critical thinking, critical analysis. And in these studies, it was a requirement. You have to do this. This is part of your assignment. This is classwork. They're going to do that because they're told to do it. But at home, when they're sitting by themselves and they're panicking to get something done at the last minute, my hunch is that they're not being so critical, and they're not really analyzing the output in the way that we would want them to do. As teachers, as future teachers, as just humans, as you know, people who exist, we want them to really, really be critical thinkers about this. So that's it, and thank you very much.
Thank you so much, and I would like to welcome up our final presenter, Cecilia Bibo, who is presenting Evaluating AI Tutoring in STEM Education, Student Feedback, Performance Outcomes, and Implications for Ethical AI Design. Welcome.
Right. So thank thank you for the introduction. Good afternoon, everyone. My name is Cecilia Bibo. I am a visiting assistant professor in educational policy and leadership at the University of Albany. And today I'm here presenting the preliminary insight from a project about AI tutoring in classroom. And I'm here together with two team members, Professor Barbara Giunti from the Department of Mathematics at the University of Albany, and Samantha Rodriguez, PhD students in mathematics from the University of Albany. All right, so Barbara and Samantha will be joining me presenting some sections of my project. All right, and we would like also to thank all the organizers for having us today, presenting the first results of our study. All right. So the aim of this presentation is to take a closer look at what tutoring systems are actually doing in real classroom. So we're seeing a very rapid expansions of these tools in higher education, often justified by scalability, personalization, efficiency. But at the same time, there are persistent concerns that deserve careful attention. So this includes questions about how AI affects students' autonomy, so the risks of over-reliance on these tools, and issues around transparency and explainability. So there are also important tensions related to data privacy, surveillance, and the extent to which AI may really begin to substitute for core learning processes or structured judgments. So what this discussions argues for is the need for to ground these debates in empirical classroom-based evidence, so looking closely at how students and instructors actually experience AI tutoring in practice. Okay, so I want to pause briefly on what AI tutoring means, because the term is used in many different ways. So here we're drawing on a working definition used within SUNY. So this definition has been developed by the SUNY Fact2 Task Force on AI in Action. And based on this definition, AI tutoring is an advanced educational tool designed to replicate certain functions of a human tutor. So it stimulates one-to-one tutoring through active engagement, so like reasoning, meaning making, and learning from prior interactions. AI tutors features include the opportunity for personalization, interactivity, and the ability to adapt feedback based on the student's inputs, right? So this is what actually differentiates AI tutoring from a more static, traditional educational technology. All right, so there can be many benefits of using AI tutoring in the classroom. First of all, students feel more engaged and motivated. There is also the opportunity for them to feel reduced barrier to help seeking for help. So because AI tutoring are available to the students in every moment, so there are some students that, for example, feel embarrassed about approaching an instructor or teaching assistant with questions, and they may feel more comfortable interacting with an AI tutor. And some students also have shown gains in student learning outcomes, so with the use of AI tutors, so particularly when, for example, the tutors provide formative feedback to support ongoing improvement and development. Okay, all right, so let me briefly situate the project. So this is part of an ongoing research effort conducted within a course at U Albany for 3 semesters, so multiple cohort, where AI tutoring was introduced and an optional learning support. So the focus is on a non-real-time open-source AI tutoring system, which means that students interact with the tool asynchronously and have time to reflect rather than having continuous conversation or receive instant answers. So the core questions guiding the study is, under what condition can AI tutoring generally support student learning without undermining the pedagogical and meaningful practices? So the name of the tool that we have been using so far is the Open Adaptive Tutor. So it was developed by the University of California, Berkeley. It's an open source adaptive tutoring system that serves as a platform for deliver mathematical questions within hints, multiple hints. And these hints are, as well as the questions and the answers options are defined by a human, so the structure. In 2024-25, the SUNY system launched an initiative to implement an AI tutor for potentially all campuses and in the system, and the project team piloted multiple AI tutoring systems in fall 2025, and one of these tools has been the OTutor. So why focus on a dynamic, non-real-time AI tutoring? So this was a very deliberate design choice. So the system was built with a clear constraint. So not ongoing conversation continuously, no constraint, constant monitoring, and no adaptive nagging. So in education setting, the risks of AI hallucinations presents a significant challenge. So potentially having detrimental effects on students' learning. If AI generated hints, as the previous speaker underlined, give a non-correct answer, so is extremely detrimental, this aspect. And so from a pedagogical perspective, the goal is to slow things down rather than speed the learning process up and break down the complex concepts into very small units that can be easily digested by the students. So much of the current development in AI tutoring emphasize flexibility and adaptability, and which can be pedagogically valuable when it helps tailor the learning process, right, of the students based on the students' needs. But at the same time, research evidence suggests that too many inputs and degree of freedoms in the process can be counterproductive. So by removing, for example, instance back and forth and introducing a certain degree of adaptability, so the system encourages students to pause, reflect, make their own decisions instead of relying on immediate answers. So this helps preserve students' agency and keep, at the same time, its structures firmly in control of how learning unfolds in the course. So there is also a clear ethical rationale. So a dynamic but non-real-time system reduces privacy risks, which is a particularly complex issue when developing an AI tutoring system for teaching and learning, because it limits continuous data collection. So in this way, a dynamic, no real-time AI tutoring is sort of a bounded support for students. All right, so despite the rapid growth of AI tutoring system, actually there is no clear policy of regulating their use in the classroom. So, but a few frameworks have been developed, and we have used these frameworks to structure the perimeter and ground the analysis. So this project is grounded in a human-centered approach to AI. So the starting point is the idea that AI tools should be designed around the educational values and learning goals, and not vice versa. And more concretely, the framework builds on the SUNY FACTSU guidance on optimizing AI in higher education, which emphasize intentional design, transparency, and instructional alignment. We also use a study and align our study with the UNESCO 2024 AI Competence Framework, paying attention to both teachers and student competencies, and this helps us to situate the work that we are doing within a broader international conversation about responsible and ethical use of AI in classroom. All right. So the study is organized around three complementary strands. So the first one, we look at the students' experience. So what students say about using AI tutors, how helpful it was. The second one is we examine the performance outcomes by comparing the assessment of the students when they use the AI tutor. And the third one, we focus on the structure side. So documenting the implementation process, how the AI tutor was designed, the pedagogical choice behind it, and the practical and ethical challenges that emerged along the process. So let's focus first on the students' learning process. Since the study is in progress, these are preliminary themes based on reflections and feedback collected so far, including extracurriculum activities with students, colleagues, and experts. So overall, the students tend to use the AI tutoring system as a study aids rather than an answer generators, which is apparently very promising information. And many describe feeling more confident, motivated, and better prepared. And they point to changes in how they organize. For example, they study and regulate their learning. At the same time, there are some other mixed tensions. For example, students appreciate the structures and the guidance, but some of them raise questions about dependency and how much trust to place in the tool, the data that are collected, and some others instead prefer more flexible environment, like, for example, a chatbot. And regarding the performance outcome, so this is the next phase of the analysis. The goal here is to try to make casual claims, is not to try to make casual claims, of course, but to try to compare patterns across a selected assessment. And based on informal discussion with colleagues who piloted the AI tutoring, there seems to be no uniform performance gains. So outcomes vary depending on the type of task and how students engage with the AI tool. And colleagues also underline the importance to use performance data to help contextualize what students report about learning with the AI tutoring rather than override them, their perception. And now I would like to leave the floor to my colleagues, Barbara, to explain a little bit how we will analyze the data. 2 more minutes.
Yeah, I will be very quick. Also, we are at the end of the day. I'm a mathematician, so I will not hit you with a lot of technical things. What I just wanted to mention is that instead of using statistical methods or even machine learning method to analyze the data, we're going to use something called a topological data analysis, which I am an expert on. And please do not ask AI, because I just noticed that Google really hallucinates what are the properties of this new news area of research. So it's a new area of mathematics and data analysis. It is incredibly interpretable, and it gives us high-order relation, which is exactly the kind of things that we may look for. And my colleague Samantha will give you some hands-on example in a moment. The very cool things about it is that it can be applied to virtually any data. So if you have text, if you have numbers, if you have a mix-up of these things, you can still use it, which is very cool. And of course, the other extra very cool things is that congratulations for being in Albany, because SUNY Albany has one of the largest TDA groups in the world. So if you want to know more about how to use this data, not just in the specific project, but in general, also in combination with AI, there are 4 professors. We are very happy to collaborate. So yes. And now I'm going to leave the floor to Samantha, who will explain you a little bit what are these higher order relationships.
And now for the world's quickest introduction into topological data analysis. What we're going to do is start with any set of points, and each of these points is going to be representing something about our underlying data. One of them here, maybe your grade is less than B-, your AI use is less than 40%. You can read the rest. 5 hints used, time watched greater than 2 hours, total AI time. The very first step is going to be to construct a circle around each of these points with some given radius. So you see this in your step 1 picture there on the right. And what we're going to do is increase the radii for each of these circles. So what we see happens is that eventually we expect these circles to intersect with each other. And when they do, we form a connection between these points. In step 2 here, you see that there's some sort of connection between the grade being less than B- and the AI use being less than 40%. This sort of hints at there is some sort of underlying connection between these 2 features that we're looking at. As we increase the radii, maybe we get something that looks like our middle graphic here, step 3, where you form some sort of loop between your points. You have connections between points A and B, B and C, C and D, D and E, E and A, but none of the interlying connections. So there is some sort of comparison and connection between each of these individual features in our data, but not yet between all of them. What we're going to do is when we first form this loop, we mark the radius that happens at. Continue growing our radius and wait for all of the connections to be made. When that happens, that's when our loop ends. And you try to analyze and see how long such a loop lasted. That length, or the largest radius minus that smaller radius, really helps to indicate what different features in the data are very unique and very prominent and influential in whatever it is that you're trying to better understand. Something that traditional statistical methods do not capture.
Thank you very much to my colleagues. And I'm going to go very fast to the last slides. So, so what we have learned so far, so the project is ongoing, but we would like maybe to share with you a few concluding thoughts. So this finding points to a few clear directions for future AI tutoring design. So first, privacy really has to be built in from the start of the process with minimal data collections and clear boundaries about around the use. Students also need transparency, so as the prior presentation underlines about what the system can do, what it cannot do, and how it means to support their learning. Another key implication is the importance of preserving meaningful struggle. So students need to struggle when they learn. AI can help scaffold learning, but it shouldn't remove the cognitive work that actually lead to understanding. And finally, those results suggest some cautions in generalized to real-time chatbots. So what works in a constrained reflective setting centered around the students and the teacher may not translate directly to always-on conversational systems. All right, so these are a few resources that for those of you who are interested in learning more about AI tutoring. And thank you very much for your attention.
I'd like to thank all of our panelists. That was excellent. I would also like to, moderator's privilege, I get to do this. Before we open it up for Q&A, I just want to draw the parallels between this panel and the last panel on healthcare and how pervasive AI has become between these two sort of crucial pieces of human development, both in the way that practitioners use AI as well as the way that patients or students, both of which are sort of the receivers of the healthcare and the education, are using AI and are being exposed to AI, and this increasingly loud call for governance and sort of forward-thinking planning around both of those poles. Moderator privilege over. I'd like to open it up for Q&A. Again, please raise your hands and wait for the microphone so that our folks watching at home can actually hear your questions. Who's first? Oh, right up here.
Thank you. So I have a question, but it's forming as I'm thinking of it. I wanted to talk about trust. So I noticed that in the last what's happening? I don't know what just happened. Anyways, I'll just speak louder because I don't know what just happened. I noticed in the last panel about trust that when it comes to healthcare, trust is a very big factor, especially considering how important and crucial the healthcare industry is and all of the private and sensitive information that go within that process. But within the the education realm, we see that students especially are more trustworthy of the technology. And I also noticed that within the teacher example of teaching teachers and how they weren't necessarily satisfied with the results, and yet they still have a level of trust within using the technology itself. And so I kind of want to connect that to dependence and over-reliance and pose a question of how you all believe that we can essentially spread more awareness within students to not necessarily have as much trust and to be a little more skeptical of what's actually happening so that we can ensure that learning is still occurring and that we're not necessarily just overly relying on AI.
Yeah, go ahead.
So I'm a teacher educator, right? So I believe if something is created as a vendor to capture data, our trust should be very limited, because when you look at what Mattel is proposing to put like a little AI thing into dolls that you place with your baby, so that there can be a dialogue between basically Mattel and your children, reminds me of The Welt. If anybody likes science fiction, The Welt is one of the it's a very fabulous little vignette of what can happen. When I talk about trust between a teacher and a system, it is, as a teacher educator, our responsibility collectively to encourage that curiosity intellectually, and also the ability of students to ask the hard questions. Because here's the issue. Students often use AI for cognitive offshoring, right? So over there. So now the question is, how can we as educators interfere in that process, because we're all lazy, right? I mean, if I could have a little robot picking up dirty laundry, I would buy it in a flash. So I have changed my assignments. They are no longer paper-based. So when I talk about an instructional method or scaffolding or different things, I now require that you do the demonstration in a video and then do an annotated paper and label your video, because I do three things. One, I require you to use embodied cognition, your whole physicality, because we must be present. We're not a head on a stalk. Two, I require you to use technology on a very high level, because you have to annotate your video. And three, I'm requiring you to connect the theory back to your practice. And that is what we need to do. And that's how we build trust, or not.
I love this question so much, and one of the privileges of the work I get to do is I do a lot of work around student leadership and student voice, and I've done some work now doing some student summits where we bring together students from the 7th all the way to the 12th grade to talk specifically about AI. We help the students design the summit themselves, because I've learned that we know nothing as adults and we should let them drive the agenda, and we just simply help them facilitate it. So the last one that I did, they wanted to talk about digital identity and relational leadership, and the entire conversation was really around the learned skill of empathy and how they feel as though AI, there's a lot that AI can do for good, but there's a lot that it can do that harms their own development as individuals, particularly when it comes to the skill of empathy and thinking through what their digital identity is in front of the screen versus behind the screen. And so what I will say is that I think that we assume that the students are trusting, but they are sort of responding to what we put in front of them. And they're worried that the adults in the room aren't necessarily making the best decisions for them. And I'll just use an example. The group I was with talked about a lot of fear. I mean, these were 7th graders talking about a lot of fear for the 1st graders and the 2nd graders and the 3rd graders, that they wouldn't have the same educational experience that they did, right? Which was like, you know, I have to act, I'm the adult in the room, so I can't react. But I mean, to hear that, and they talked a lot about how they could tell their teachers who were using AI and sort of checking out to teach versus those that were not doing that. And they said they might be using it somehow, but they're engaged in my learning, they're a safe adult, they're helping me to learn how to be a good person. And so I guess my point here is that I think that there is a lot of trust, but there's also a lot of fear. But many times with students, we don't necessarily give them the autonomy to speak to us like they are our peers. And if we do give them that autonomy, we would learn that they oftentimes know how to use these tools much better than we do. They could probably spot those blind spots way quicker than we can, and their fears are quite human. And so I think if we're able to listen to them and to see them as leaders and help them use their voice, we could learn a whole heck of a lot.
If I may also address that question, and thank you for it, because it got me thinking as I'm sitting here. And in thinking about the difference between why in the healthcare realm people would be resistant to it and not trust it, while in education it's quite the opposite, or at least from my data, I think it has to do with vulnerability. That would be sort of how I frame it, because in a healthcare situation, I'm a patient, you're the doctor. If you're the doctor and you're using AI, I'm at risk, because what if AI gets it wrong? In education, as my colleague said, they're offshoring their thinking. So I don't want to look stupid as a student who may or may not know my math, or may or may not know how to write, or may not feel confident in it. I may be fine, but I may not feel confident. And thus, I will offshore that, because it's less risk to me as the individual. So it's more risky for me to have my doctor use it, so I don't want that, but it's less risky for me. Now, there's a lot of in between there that I think we need to think about, but I think all of these considerations need to go into these frameworks that we hope are in the process of being developed, and how to deal with it and how not to deal with it. Thank you.
Next question.
I'm not sure this is working, so I'll speak loudly. I had a totally different question, but Nikaley's brilliant question led me to another thought. Particularly in relation to, Teresa, what you presented. In science and technology studies, we talk a lot about the authority of expertise, and who gets to have that, who gets to perform that, who is granted that, right? And so it struck me from your question and what you presented, right, that perhaps there is this extension of the authority of expertise to a thing, to AI, and that different expectations and privilege in relationship to authority, so perhaps a doctor as opposed to a teacher, or a student or a patient, might grant or not grant that extension more readily. And so I'm guessing, I'm wondering if you can reflect on that a little bit.
I think that's a great question. Well, in my study, my students were very ready to farm out their authority in certain ways, especially when they felt like maybe they would get something wrong in front of their peers. And they're about to teach. So, what's interesting is, again, they didn't really like the lesson plans because they felt that that would make them look like poor teachers. I can't stand here and talk for 40 minutes. That's not how you teach. You have to engage the students. It has to be student-centered. But when dealing with the mathematics, they had less confidence, even if they're math people. I mean, they were math majors, but there's varying levels of confidence for everybody, and even math people can have math anxiety. And in the situation with the research question, that was completely new to them, so they were happy to use AI for that. That was not something that they felt like they had any ownership over. It was new, it was very foreign, and it was not something that they were used to. I hope that addresses your question.
Thank you so much.
I think we need to focus on what is content, right? When you take Bloom's taxonomy, without remembering anything, you can't understand it. So I propose that we keep to some of the basic things that we need to. You cannot speak a language without learning vocabulary. It's just not possible, or some of the grammatical structures. And if you let an AI, let's say, do a translation in Alaska, you have 15 words for snow, and in Florida, you have 1. Okay, so you will lose all of the linguistic nuances and many other cultural nuances that are within our experiential systems, and so for me, when we look at who gets to have the expertise needs to lie in our educators, who are facilitators, to help to guide, because the generation of artificials, the children who are born today, will never know a world without AI. For them, the hardest piece of knowledge will be how to distinguish between synthetic data and real knowledge. And I have to leave for the Amtrak train soon.
I saw there was a question back here to begin with. Do you still want your question?
Very relaxed.
I had a 3-year-old. About the test with AI. So was it a control environment with ChatGPT, or was it with a filter, with guardrail? So we use everybody uses same ChatGPT with login, without login. How was
It was an early version of ChatGPT. They all use the same one. If I were to do that study now, I probably would expand it to maybe Gemini and see if there was any differences between Gemini and ChatGPT or Copilot or any of those other ones. And then there are many others, Claude, whatever. Does that answer your question?
Yeah, I was just asking because you can, even with ChatGPT, you can control, you can make instruction, not even for people, you can instruct ChatGPT so he stay on a topic. No end user cannot kind of jump one way or another. It's a really controllable environment. If you even the GPT is like almost like $20 or something, you can create as many GPT, and this will be different. This way you can send those who test, you can send link, and then see what they respond, because it's be very controlled and filtered the way you kind of want it, but not the way you want it to get what response you want, but the way you actually do the survey. No,
Thank you.
And I just wanted to make one comment about, I was glad you were talking about ChatGPT. One of the things that we talk with students about now especially is that, I don't know if this is different with the paid model, but they're changing it every day, so it wants you to like it. Like, I don't know, you guys are probably noticing it too. It's like, you'll say maybe not the smartest thing, and it's like, you are a genius. And for you know, for students who are seeking mental health advice, relationship advice about how to interact with peers, it's very dangerous for that to start happening. I mean, we were in real time doing some work with students around AI, and there was 2 news stories that were happening. One where a student was suing, I think, Meta around mental health issues, and another one, I can't remember, but it was having to do with suicide and ChatGPT. And I think one of the things that students recognize, they deeply recognize that this is happening to them, but they are also seeking out connection, and without that connection, they will default to these tools. And so one of the things we've talked a lot about with Capital Region BOCES work with the cohort is, how do you mitigate that sort of risk? How do you take into consideration mental health, relational health, community connection? And so I think when we talk about governance and frameworks, those frameworks are incredibly important, and we've seen it, I think, in every single vision statement that all of the cohort districts have made.
Unfortunately, we do have to end the question session. We are a few minutes over. I'd like to thank the panelists again and welcome Laura Rabinow back up.
Are you familiar with the lawsuit? I hit check the podium on my way up. Thank you again to all of our panelists. The conversation today was just incredibly engaged, so thank you to everyone in the audience, everyone on the live stream, to all of our staff, and to all of the staff at the AI and Society Research Center. Our deepest thanks for your collaboration on this event. I'm going to close out the formal part of our proceedings today, but this space is open to everybody until 4:30, so please feel free to stay, connect, and continue to deepen those conversations around these critical issues. Thank you again.